everyone. So let's start with the image-based anatomy MCQ session before the examination of NEET-PG 2022. So let's start with discussing few important images. So let's start with the first MCQ. So identify the artery marked in this cadaveric image. So we can see here the inferior aspect of the brain, and we can see a red color identification has been shown. So a red color highlighted area has been shown in this image, and you have to identify which of the following artery is it. Is it the middle cerebral artery, or it is the bacillar or the vertebral artery? Okay, so this you have to identify. 4 options are there, so go for it. I will also check the messages and we can know that which is the right answer here. Okay. So yes, okay. So let me just check. I'm getting okay. Many of the students has given the answer D and A also. Okay. So there is confusion between D and A. So my dear aspirants, the correct answer is D. This is the internal carotid artery. Which artery is this? This is internal carotid artery. Okay. So yes, let me just take this image and let me go with the identification of the important vessels here. Yeah, many of the aspirants has already given the right answer. DA. Most of you have given the right answer, that is D. Now here I want to just enlarge this image and highlight the important. Yes, the red color highlighted area is definitely internal carotid artery. But if you will see these 2 arteries here, these 2 arteries which is joining here, so these 2 arteries are vertebral artery of both the side. The vertebral artery of both the side will join here and will lead to the formation of bacillar artery. What is this? This is the bacillar artery. Yes, good evening everyone. So this is the bacillar artery, and the bacillar artery is residing in the bacillar groove of the pons. Now, you can also see here it is dividing into further branches. Okay, so here you can see it is dividing into further branches. So this artery is PCA, that is posterior cerebral artery, and this artery is superior cerebellar artery. This is superior cerebellar artery. Okay. So now this is ICA, which is called as internal carotid artery, which is forming the lateral boundary for the circle of Willis. And then you can also appreciate here the anterior aspect. We have got ACA, that is anterior cerebral artery, and the connecting link here is the anterior communicating artery. Which artery? Anterior communicating artery. So my dear aspirants, few of the students has given the answer as the middle cerebral artery. So I would just like to highlight it. Can you see here the artery which I am highlighting here? This is the artery which is going towards the lateral groove and the lateral sulcus. This artery is MCA, that is middle cerebral artery. And please note down that middle cerebral artery is not taking part in formation of circle of Willis. It is not taking part in formation of circle of Willis. So definitely the correct answer will be internal carotid artery. Okay, so you can just practice this. So this is another diagram where the schematic diagram has been shown so that you can better understand here. And if you correlate here, this was the artery which has been asked in the MCQ, and this is ICA, internal carotid artery. These are ACA, and this is bacillar artery, and these are the both the side vertebral artery. Also, one of its branch which is going towards the cerebellum, this is pica artery, posterior inferior cerebral artery. This is anterior inferior cerebral artery, branch of bacillar artery. These are P for the pontine branches. This is the terminal branch of bacillar artery, posterior cerebral artery, and this is superior cerebellar artery. So these are branches of bacillar artery, and this artery which is going towards the supralateral aspect of the brain, this artery is MCA, middle cerebral artery, not taking part in formation of circle of Willis. Now let's move on to the next MCQ. This was the question which has been asked in 2019 AIIMS entrance examination. This is question number 2. Lesion of marked structure in the image could lead to which of the following feature? Okay, so you can see here one of the images which is showing the ventral aspect of the brain stem. So you can see the image where you can see the ventral aspect of the brainstem, and you have to tell me the arrow is marked over one of the elevation, and you have to tell me which will be the characteristic feature, whether there will be ipsilateral paralysis of palate and the pharynx, there will be ipsilateral paralysis and atrophy of the tongue, ipsilateral facial palsy, or contralateral hemiplegia. So many of the aspirants has already given the answer, and definitely this was the question asked 2 years back in the AIMS entrance examination, and the answer will be contralateral hemiplegia. So absolutely correct. And the area which is the arrow marked here. So if you can see here, this elevation is P. What does P stands for? P stands for pyramid. Okay, what is this? Pyramid, which is formed by corticospinal fibers. And here there is crossing over of the fibers. So there is crossing over of pyramidal fibers or pyramidal tract. That means there is, if this is the area involved, the resultant feature which will be seen is the contralateral hemiplegia. Okay, so we can see here this, the either side you can see another elevation, which is the question mark. I'm asking what is this? If the midline structure is P, can you tell me just lateral to pyramidal elevation? We have got olive. What is this? This is the olive. This is the pons, and this is the bacillar groove. This is BG for the bacillar groove, which you can see here. And definitely pyramidal tract will be involved, and the correct answer will be corticospinal tract, crossing over of the fibers. Yes, olive, absolutely right. Lavanya, absolutely right. So yes, definitely that is the right answer, and this will be the presentation, and the answer will be contralateral hemiplegia. Absolutely correct. Let's move on to the third one. So this was also asked in 2020 AIMS entrance examination. Blood supply to the marked structure in the given image is derived from which of the following source of artery? Whether it is internal carotid artery, vertebral artery, the anterior cerebral artery, or the middle cerebral artery. So that means firstly you have to identify that arrow marked structure, means you have to identify this arrow marked structure in this image, and then you have to tell me that which structure and what is the blood supply of this structure. So definitely I'm again receiving many of, yeah, this is fornix. Absolutely right. Yes, this structure is a fornix, and you have to tell me the blood supply. Blood supply. So please mark the right answer. And many of the students are definitely giving me the correct answer. So I got an answer from one of the student, A594, Dr. Pragya. Yeah. So yeah. So it's ACA. So correct answer is the ACA. Yes, it is anterior cerebral artery. So the structure is fornix, and fornix is getting its blood supply from short, medial, central branches, or the branches of anterior cerebral artery. So definitely anterior cerebral artery is the correct answer. So let me just enlarge this. Now here I would like to highlight the structure which has been asked here. So this was the structure which has been asked in the MCQ, and this is definitely fornix. This is definitely fornix. Okay, no. So few of the students here is writing corpus callosum. Don't confuse with corpus callosum. This structure which you are seeing above is the corpus callosum. So this structure which you are seeing is the corpus callosum. Below corpus callosum, okay, so this is corpus callosum. And below corpus callosum, we have got the fornix, and in the MCQ, it has been asked that what is the blood supply of fornix? The connecting link between the corpus callosum and fornix is done by this membranous structure. And what is this called as? This is called as septum pellucidum. What is it? This is septum pellucidum. This is septum pellucidum. So my dear aspirants, if I have to talk about its blood supply, fornix is getting its blood supply from the short, medial, central branches, that is the branches of anterior cerebral artery. So please write down the blood supply of fornix. Fornix is getting its blood supply from the source of anterior cerebral artery. Anterior cerebral, ACA. What is ACA? Anterior cerebral artery. ACA is anterior cerebral artery. What is ACA? Anterior cerebral artery. Okay. And to be more specific, which part, that is the short medial central branches, short. So short, write on short medial central branches of anterior cerebral artery. Okay. So many of the branches, okay, let me check. So few of the students are also asking few doubts in the YouTube session. Yes. So mainly the blood supply of corpus callosum is from anterior communicating artery, pericallosal artery, and posterior pericallosal arteries. Okay. So if you want to write the blood supply of the corpus callosum, few of the students is also asking the blood supply. So please note down if you want to ask corpus callosum blood supply. So corpus callosum is getting blood supply from anterior communicating artery, anterior communicating artery, pericallosal arteries, and also from the posterior pericallosal arteries, posterior pericallosal arteries. So yes, let's move on to the next MCQ. Many of you have given the right answer. Let's move on to question number 4. Let's move on to question number 4. Yeah, it's okay. So let's move on to question number 4. Please read the MCQ and mark the correct answer. Which of the following muscle is not supplied by the marked nerve in the given section? So you can see this image and you can mark the right answer. The arrow mark structure, you have to just identify this arrow mark structure, and then you have to tell me which of the following structure is not getting innervation by the nerve marked. So yes, again, many of the aspirants, it's the third cranial nerve, okay, oculomotor, and yes, absolutely right, Dr. Monisha, Swati, 594. Yes, absolutely right, everyone. Yes. So yes, you can, if you are not able, I want to give you a hint also. If you are not able to identify this nerve also, then also you can go for the right answer. And how you can approach it, I will tell you, because here you can say inferior oblique is getting its nerve supply from third cranial nerve, medial rectus from third cranial nerve, superior rectus from third cranial nerve. Okay. So yes, so only when we are talking about the superior oblique, when we are talking about the superior oblique, this is the odd man out, which is getting, this is the odd man out, which is getting its innervation from SO4, that is trochlear nerve. So this is the odd man out. So definitely B is the right answer. Yes, Jay, you are absolutely right. How many questions? 50 questions, dears. 50 question is there to be solved. So definitely that is the right answer. Yes, odd man out. Namita is absolutely right. Yes, Namita, you are absolutely right. Now, I just want that this kind of a similar MCQ can come for you. What is actually important, that all the images which I have shared today in this 50 MCQs, we will solve that images and we will see all important markings there. So let's identify all the structures which is seen in this cranial cavity. So this is the olfactory. So you can see here, this structure is the olfactory bulb, olfactory nerve, or the first cranial nerve, and this is the cribriform plate. This is the cribriform plate of the ethmoid bone. Okay. Now, other than that, you can see this is the second cranial nerve, optic nerve, and this artery is ophthalmic artery. This is the ophthalmic artery. So that means olfactory nerve rootlets is passing through cribriform plate of the ethmoid bone and through the optic foramen, second cranial nerve, and ophthalmic artery is passing. Also, you can appreciate here the structure which is shown, which I am highlighting with the green color. This structure is the pituitary stalk. This is the pituitary stalk. Okay. Other than that, you can also identify a few other important structures which has been seen here. You can also identify, this was asked in the MCQ, that is the third cranial nerve. Here you can see this is the fifth cranial nerve. Close to it here is the sixth, and this is the fourth cranial nerve. Also, you can appreciate here, this is the here you can see this is the fifth cranial nerve. So here you can see, which is showing here 3 divisions. So from anterior to posterior it will be O, that is ophthalmic, this will be maxillary, and this will be the mandibular division. This will be the mandibular division of trigeminal nerve. Other than that, you can also appreciate here posterior to it, there is two foramens. This one is the one and this is the other one. So here, this will be 7th and 8th cranial nerve passing through the internal acoustic meatus, and 9th, 10th and 11th cranial nerve passing through the jugular foramen. Okay. Absolutely right. And this is the 12th cranial nerve. So that means we are able to identify all the cranial nerves which is traversing through the different cranial foramina. Okay. So we are done with this. Other than that, I would also like to highlight this image and also want you to identify the sinuses, dural venous sinuses, which is shown here. So you can see here, this is the TS for transverse sinus. Okay, this is the cut end of superior sagittal sinus, and this is the sigmoid sinus, which is shown in this diagram. So is it okay? Let's move on to the next MCQ. Okay, let's move on to the next MCQ. Okay, so let's move on to question number 5. All the best. Let's move on to question number 5. Okay, all of the following statements are correct about the structure labeled in the image except. So you have to read the important labelings which is shown here. So you can just go through this labeling and you have to tell me all of the following option is correctly labeled. So here A, you have to identify what is A. If you want, I can slightly enlarge this image and you have to identify. Structure or labeling which has been done. So I got an answer A. Okay, I'm getting an answer AC. Okay, AC. Let me just check. C. C is attached to popliteus muscle. Okay, A and C. So I'm getting mixed bundle of answer. Okay, so let's talk about, okay, so Venkat Nikhil is telling 12th cranial nerve is Wallenberg syndrome. 12th cranial nerve is a midline structure. It is involved in medial medullary syndrome, not in lateral medullary syndrome. Venkat Nikhil, yes, 12th cranial nerve, hypoglossal nerve will be involved in medial medullary syndrome and it is spared in lateral medullary syndrome or the Pica syndrome or Wallenberg syndrome. Okay, Venkat. So no, the correct answer is definitely A is the correct answer. And let me tell you why. A. So first thing is that what is A? So if I enlarge this image, so just concentrate here and you can see that A and B are cruciate ligaments. So here A is anterior cruciate ligament, B is posterior cruciate ligament, D is medial meniscus and C is lateral meniscus. C is lateral meniscus. Okay, so you can see here that there are two meniscus semilunar cartilages inside the cavity of the knee joint, and we have got two cruciate ligament. The next thing is that we have to know the important features. So here in the option A, it is written A is degenerated tendon of adductor magnus muscle. What is A? A is anterior cruciate ligament, and the cruciate ligaments are important for the antero-posterior stability of the knee joint. And my dear students and my dear friends, ACL is not the degenerated tendon of adductor magnus. Can anybody tell me which ligament of knee joint is degenerated tendon of adductor magnus? So this is a question for everyone. Can anybody tell me which ligament of knee joint is degenerated tendon of adductor magnus muscle? MCL. It's the tibial or medial collateral ligament. Absolutely correct. Gayatri, Soumya, Vishnu, absolutely correct. Very good. Very good. Yes. So you are absolutely correct. Yes. It's the tibial collateral ligament. It's the tibial or the medial collateral ligament. It's the tibial or medial collateral ligament, which is actually the degenerated tendon of. This is degenerated tendon of hamstring part of adductor magnus muscle. Adductor magnus muscle. So definitely we have got the correct answer A, and A is the wrong statement. Other than that, B is intracapsular. What do you mean by B is Yes, definitely the cruciate ligament. So B is posterior cruciate ligament, and we know that cruciate ligaments are intracapsular structures. Also, the menisci cruciate ligaments are intracapsular structure. What about C? C is attached to popliteus muscle. That is absolutely right. You can see here the lateral meniscus is separated from lateral collateral ligament. In between, it is attached to popliteus ligament. So it is more flexible and mobile and less commonly injured. In respect to medial meniscus is more commonly injured. Why? Because medial meniscus is adherent to tibial collateral ligament. So definitely that is the right answer. Absolutely correct, everyone. Let's move on to the next MCQ. That is MCQ number 6. All of the following are branches of marked structure in the image except. All of the following are the branches of marked structure in the image except. So we have got A, renal artery, we have got B, ovarian, C, uterine, and D, superior mesenteric artery. So the thing is that firstly identify that arrow marked area and then tell me the right answer. So yes, I'm getting D, I'm getting C. Okay, I'm getting D and C. Mixed bundle of answers. So the structure is, yes, definitely C is the right answer. C is the right answer. And the reason is that why C is the right answer? Because uterine artery is the branch of anterior division of internal iliac artery. It's not directly the branch of abdominal aorta. So yes, C is absolutely correct. C is absolutely correct, dear. Yes. So let me just show you. This was the structure which has been asked in the MCQ. This is abdominal aorta. And we know that in uterine artery is not a branch of abdominal aorta, but it's a branch of anterior division of internal iliac artery. So quickly, just let's revise the branches of abdominal aorta. Branches of, when I'm talking about ventral branches or anterior branches of abdominal aorta, it is given at the level of, so celiac trunk is given at the level of T12. We have got superior mesenteric artery given at the level of L1. We have got inferior mesenteric artery given at the level of L4. And we have got also visceral branches, gonadal arteries. We have got renal arteries. We have got suprarenal arteries, also gonadal arteries. And we have got also the parietal branches. So a similar diagram, which is better. You can see here, the other branches are inferior phrenic. It is also giving 4 lumbar branches, 4 pairs of lumbar branches. Terminal branches are middle sacral and common iliac artery. Common iliac arteries, right and the left common iliac artery. These are also the terminal branches. So you can see here in this diagram that uterine artery is not a branch of abdominal aorta. Now I would like to show you this image where you can appreciate the branches of anterior division of internal iliac artery. Branches of anterior division of internal iliac artery is obliterated umbilical artery, superior vesical artery, obturator artery, inferior vesical artery. Corresponding part in case of females is vaginal arteries, uterine artery, which was asked, also artery to ductus deferens, that means vas deferens, middle rectal artery, internal pudendal, and inferior gluteal. So what I have highlighted in the red color, these are all the branches of anterior division of internal iliac artery. Which artery? Internal iliac artery. Now, my dear aspirants, I would also like to appreciate here lateral sacral, superior gluteal, and iliolumbar. These three arteries are the branch of posterior division of internal iliac artery. Okay, so yes, definitely. Ma'am, can we get the PDF? Yeah, we will just check. Firstly, let's discuss quickly the MCQs. Okay, without wasting much of the time, as if the exam is near. So we will quickly solve it. Okay, now let's focus on to the next question, number 7. All of the following are true regarding marked structure in the image except. All of the following are true regarding marked structure in the image except. So my dear, can you see a black arrow has been labeled on one of the muscles? So you have to tell me what is the wrong statement about this structure. Originates from medial surface of lateral pterygoid plate, supplied by mandibular nerve, depressor of mandible, protractor of the mandible. So your time starts now. Definitely I'm getting, yeah. So the identification given by Dr. Monalisa, Many of the students has given the identification right. Now I want the correct answer. Yeah. So which of the following is the wrong statement about lateral pterygoid muscle? Which of the following is a wrong statement about lateral pterygoid? So definitely A. A is given. Okay. What about others? Yeah. So yes, definitely A is the right answer. Lateral pterygoid muscle doesn't originate from medial aspect of lateral pterygoid plate, but it originates from the lateral aspect of lateral pterygoid plate. Let me just enlarge this image. Okay, so in this cadaveric image, I would firstly like to tell you what are the muscles which can be appreciated here. So you can see here, this is the one muscle which is fan shaped. A part of this muscle has been shown. So this muscle is temporalis muscle, one of the masticatory muscle, temporalis muscle. The other muscle which can be highlighted here is LP for lateral pterygoid, which has been asked in the MCQ. The other muscle on the deeper aspect, this is MP for medial pterygoid. Also, you can see a cut part of the muscle which is attached onto the ramus of mandible. This is masseter muscle. Okay. And this is buccinator muscle. This is buccinator muscle. So these are the muscles which can be clearly identified in this diagram. Okay. So that is quite clear, and many of the aspirants have definitely given the right answer that lateral pterygoid muscle is the muscle asked. So let me give you let me show you another image where you can appreciate lateral pterygoid muscle, and you can see here that lateral pterygoid muscle is having two heads of origin. Can you see here? This is the upper head of lateral pterygoid muscle. This is upper head of lateral pterygoid muscle, and this is the lower head of lateral pterygoid muscle. LP in short form I'm writing LP. So upper and lower head of lateral pterygoid muscle is appreciated. So if I talk about origin of lateral pterygoid muscle, the upper head of lateral pterygoid muscle or the superior head of lateral pterygoid muscle originates from infratemporal surface of sphenoid bone. And if I talk about its lower head or the inferior head, it originates from the lateral pterygoid plate lateral aspect. So please write down. Upper head originates from infratemporal surface of sphenoid bone. Okay. And when I talk about lower head, it originates from lateral aspect of. So please note down, it is the lateral aspect of lateral pterygoid plate. It is from the lateral aspect of lateral pterygoid plate, not medial aspect, which has been mentioned in the MCQ. And the other point which is quite appreciable in this diagram is the insertion point of lateral pterygoid muscle. So here you can appreciate this lateral pterygoid muscle after originating from infratemporal surface of the sphenoid bone and the lateral plate of lateral pterygoid, it is inserting into its structure. It is inserting and it is merging with the articular disc of TM joint and that of fibrous capsule. So it is merging with fibrous capsule and articular disc of TM joint, temporomandibular joint, and also inserts into pterygoid fovea. So yes. Okay. So done with this. Other than that, if I talk about its action, so definitely this is the muscle which is causing depression and protraction and also side to side movement of the mandible. So yes, this topic is image based, cadaveric image based session. It's image based session. Okay. So definitely we have got the right answer. Origin once more. Okay, Raghupati, why not? Sure. See here. So let me show you. So can you see there are two green bellies which is shown? Raghupati, please concentrate. We have got two green bellies. See here. So upper head and we have got lower head. So when I'm talking about upper head, it is originating from infratemporal surface of sphenoid bone, and lower head is originating from lateral aspect of lateral pterygoid plate. Raghupati, It's the lower head originating from lateral aspect of lateral pterygoid plate and upper head of lateral pterygoid muscle originating from infratemporal surface of sphenoid bone. What about the insertion? Insertion occurring in the fibrous capsule articular disc of TM joint and pterygoid fovea anterior to the neck of the mandible. Okay, thank you. Thank you. Great, Raghupati. Let's move on to the next one. That is question number 8. So question number 8, which of the following option is correctly labeled in this image? Which of the following options are correctly labeled in this image? Which of the following options are correctly labeled in this image? So please go through all the labeling. Okay, if you want, I will just enlarge this image. So all of you, I have enlarged this image. So please firstly identify layer 1, 2, 3, and 4, which has been marked here. And then again, you can see the correct order. Then again, you can see the correct order. So this is how you can proceed for this MCQ. So let me just check how many of you have marked it right. So yes, I think I have discussed this MCQ prior also. And when we were discussing the scalp class, okay, very good. So that is good. And most of you are absolutely right. Yes, the correct answer here is epicranial aponeurosis, the cranium, the dura, and the arachnoid. So let me just check this cadaveric image and help you to understand the layers. So how we are knowing, when I'm enlarging this image, you can very correctly identify. You can see here the muscle belly. You can see here, this is the muscles which is shown here. So this is aponeurotic layer. This is aponeurotic layer for the occipitofrontalis muscle. Occipitofrontalis muscle. So it is occipitofrontalis muscle. Belly aponeurotic layer which has been shown. Other than that, you can also see that this is the, that means this is the this will be the skin and the dense connective tissue layer. That means the first 2 layers. This is the 3rd layer. This will be the 4th layer that is made of loose connective tissue. This will be the pericranium. This layer is the pericranium layer. This will be the D for dura mater. This will be the A for arachnoid matter, and this will be P for the pia mater. Okay, so D for dura mater, A for arachnoid, and P for pia mater. So this is definitely the correct order of the layers which is shown. So after this, we are definitely knowing that the correct answer will be A. Let's move on to the next. That is question number 9. Okay, so you can see a highlighted image has been shown to you, which is definitely shown here. All of the following statements are correct regarding the structure marked in the image, except, so you have to see the odd man out, which is not the correct statement here. Which of the following is not the correct statement? So first thing is that you have to identify the cavity, and then you have to tell me, so which is the incorrect statement about that space marked. So I am definitely giving getting answers. Okay, many of you have given B as the answer. Genu of corpus callosum is forming the floor of anterior. Which cavity is this? Can you tell me which cavity is this? So can you tell me which cavity is this? Which space is this? Which space is this? Yes. Let me just check. Okay, so Gayatri is 3rd ventricle, and I'm getting Swati lateral ventricle, and also Dr. Kumar lateral. No, it's yes, definitely it's a lateral ventricle, and those who have mentioned lateral ventricle are absolutely correct. Yes, so this is the lateral ventricle, and we know that lateral ventricle is having different parts. It is having a its parts as anterior horn, it's having the posterior horn, it is having inferior horn, it's having the body, and we have to know the relation of different parts of the lateral ventricle. So actually genu of corpus callosum is forming the floor is not the correct. It should be rostrum. It should be rostrum. So the correct answer is B. Rest all options are perfectly correct. I would like to show you several images in which you can have an idea of relations of lateral ventricle. Yes. So yes, Osama Sheikh, you are absolutely right. It is lateral ventricle. So see this coronal section. The first thing is that we will appreciate this coronal section so this is the coronal section of the cerebral hemisphere and the brainstem. And you can see the cavity which has been asked was this cavity, and this is which cavity, dear? This is LV for lateral ventricle. Okay, this is lateral ventricle. So it is quite clear that the space which has been asked here was the lateral ventricles. Yes, you are absolutely right. Now, the next thing which is important is that we have to, I will again share few of the images where that will be a schematic diagram which will help you to understand the relations of different part of lateral ventricle. So the thing is that firstly have an idea that how the ventricular system of brain is connected to each other. So this is the ventricle, which is on the each of the cerebral hemisphere, as you can see here. And this ventricle is LV, lateral ventricle. Now, my dear aspirants, you can see here it is attached with another irregular ventricle, which is the ventricular cavity for the diencephalon, and this is the third ventricle. This is the third ventricle. Other than that, lower down you can see this in the societal view. You can see this is the shape, and this is the fourth ventricle. Now, I would also like to give you an idea how these ventricles are connected. So you can see here, one connection is here and the other connection is shown here. So my dear aspirants, please note down that lateral ventricle is communicating with the third ventricle via interventricular foramen of Monro. Interventricular foramen of Monro. Absolutely correct. Absolutely. And the third ventricle is communicating with the fourth ventricle with aqueduct of Sylvius. Aqueduct of Sylvius. So this communication is via aqueduct of Sylvius. So in this image, you can see all the ventricular system of the brain is communicating with each other. And the next important point is that we have to know aqueduct of Sylvius. Absolutely right. Absolutely right, dear. Now, let's see. So actually what happens if I just divide the whole of this, if I just divide the whole of the lateral ventricle part. So here what happens, this is A for the anterior horn, this is T for trunk or the body. Okay, this is the posterior horn and this will be the inferior horn. And it is important for us to know the relation of different parts of the lateral ventricle. So I would like to show you various schematic diagram representing the relations in the coronal section of the brain. So this is the representation of this schematic diagram is representation of coronal section of the brain where we can appreciate the relations of the parts of lateral ventricle. So in this image, you can appreciate the relations of central part of lateral ventricle. So when we are talking about the central part of lateral ventricle, what you can appreciate, it is related superiorly with the corpus callosum. It is related superiorly with the corpus callosum. It is related medially by the septum pellucidum. Medially, it is related by septum pellucidum, and inferiorly, it is related by, if I talk about its floor or inferior relation of the body or the central part of lateral ventricle, it is related with caudate nucleus, striate terminalis, thalamus, striate vein, and thalamus. So this is the relation about the central part. Now let's talk about the anterior horn of the lateral ventricle, which was the incorrect statement when we were seeing the four options. So when you are seeing this, again, you can appreciate this is the cavity of the lateral ventricle anterior horn, which is related roof or superiorly related by the corpus callosum, to be more specific, body of corpus callosum. Okay. Can you appreciate inferiorly or the floor? Can you appreciate inferiorly or the floor of anterior horn of lateral ventricle is related by rostrum and not the genu? So if you will see this diagram, you can definitely appreciate that rostrum of corpus callosum is lying in inferior relation or floor of anterior horn of lateral ventricle. It is not the genu. Medially, it is related by septum pellucidum. So this is again appreciated by seeing this diagram. So here, if you will see, this is the whole outline of corpus callosum. And in this corpus callosum, S is splenium part of corpus callosum. So this is the splenium part of corpus callosum. This is the body or the trunk of corpus callosum. This is genu of corpus callosum, and this beak-like protrusion is rostrum of corpus callosum. So here somewhere we will have the, here somewhere, if you will see, Here somewhere we will have the anterior cavity. Here somewhere we will have the lateral ventricle, anterior horn. So you can appreciate this rostrum of corpus callosum will be lying in the inferior relation, not the G for the genu. G for the genu is lying in the anterior relation, not the inferior relation. Okay. Now relation of inferior horn, it is related. It is related. Inferior horn cavity of lateral ventricle will be related superiorly with the stria terminalis, the tail of caudate nucleus, inferiorly with the collateral sulcus, as you can see here, also with the hippocampus. Same way, the posterior horn is related superiorly, tepictum, optic radiation, and its inferior aspect, it is related with forceps major and calcarine sulcus, which is forming an elevation in the cavity of lateral ventricle called as calcar avis. Ma'am, floor relation once more. Yes, why not? Okay. See here. Floor. See here. Now, so this is for you. Please, this is for Dr. Dr. Dharan, see here. So this is a schematic diagram which is showing you the cavity of the anterior horn of lateral ventricle. That means we are talking about the relation of which part of lateral ventricle? We are talking about the relation of anterior part of lateral ventricle. Okay. The anterior part of lateral ventricle in the floor is related by the rostrum part of corpus callosum, not the genu. What was written in the MCQ? That inferior or the floor part of the anterior horn of lateral ventricle was related with the genu, but it is related with which part? Rostrum of corpus callosum. This can be appreciated in this diagram also, if you will see this. So, okay, for once more for you so that you can understand, see here. So those who have not understand that relation, once more, I'm showing you this relation. First thing, you can highlight this structure, which I'm showing with green color. What is this? Corpus callosum. What is this? This is corpus callosum. Now, the whole of corpus callosum can be divided into 4 parts. See here, this is corpus callosum, and the corpus callosum parts can be divided. This is R for rostrum. This is G for genu. This is the body or the trunk of corpus callosum, and this is S for the splenium of corpus callosum. Now, the cavity which is lying inside. So can you see lateral ventricle cavity has been shown? Now what I told you, lateral ventricle cavity is the cavity which is lying in each cerebral hemisphere below corpus callosum. So if you want to divide here, this will be the anterior horn. This will be, see here, this will be the anterior horn of the lateral ventricle. This will be the body. This will be the posterior somewhere, and here will be the inferior horn. Now we are talking about anterior part of lateral ventricle. So anterior horn floor. So can you see our structure? Can you see this R structure, that is the rostrum of corpus callosum, is lying in floor of the, so it is forming floor of the anterior horn of lateral ventricle. Is it clear? Means rostrum part of corpus callosum is like this, beak-like. It is forming floor. It is forming the floor, not the anterior relation of the lateral ventricle. So here, which is the wrong statement here? So that means the wrong statement is B. Genu of corpus callosum is forming the floor is wrong. Actually, it is not the genu part of corpus callosum. It will be the rostrum part of corpus callosum. Please let me know. Is it okay? Have everyone understood? Have you understood, doctor? Yes, Dharan? Okay, great. So let's move on to the next MCQ. Let's move on to the next MCQ. So see here, this is the image. All of the following is correctly labeled in the image except. All of the following is correctly labeled in the image except. Okay, doctor. Yes, absolutely correct. So all of the following is correctly labeled in the image except. So A is ligamentum denticulatum. B is ventral and dorsal nerve rootlet. C is posterior spinal artery. D is dura and arachnoid. According to you, which is the wrong? All of the following is correctly labeled except there is one wrong label here. Yes, Osama, everyone? Can you mark the right answer, please? So yes, C, C, C. Okay, so I'm getting many of the answers are coming up C. What about others? What about others? So yes, the correct answer is Osama, D with a question mark. D with a question mark. Okay, the correct answer is C, posterior spinal artery. Actually, C is not posterior spinal artery. It is anterior spinal artery. So see here, this is the image which has been shown to you. If you want, I can just enlarge this image. Okay, so definitely. So here actually, when you will see this artery which is running along anterior median fissure in the entire length. So you can clearly appreciate this artery is running along the entire length of anterior median fissure. So this artery will be, yes, this artery will be anterior spinal artery. This will be anterior spinal artery, which is located in the entire length of anterior median fissure. It can't be posterior. As you can see, the vessel is running along the entire length of anterior median fissure. So definitely it will be anterior spinal artery, not posterior spinal artery. Other than that, all other labels are absolutely correct. Yes, we can clearly see here that this structure which has been shown here, this is the part of triangular projections which you are seeing. This is ligamentum denticulatum. So what is it? This structure is ligamentum denticulatum. Denticulatum. Okay, this is the extension of pia mater. Also, you can see here B is anterior and posterior nerve rootlets. Anterior and posterior nerve rootlets, and D is actually the dura and the arachnoid which is merged. Dura matter merged with the arachnoid matter. So definitely the wrong label. So definitely the wrong label which has been used here is the C. It's not posterior spinal artery. It will be anterior spinal artery. So this structure which was wrongly labeled. So this structure which was wrongly labeled was wrong in this specimen. This is anterior spinal artery and not posterior spinal artery. Yes. Let me just check. Yes, absolutely correct, dear. Let's move on to the next. All of the following are correctly labeled in the image except. All of the following are correctly labeled in the image except. All of the following is correctly labeled in the image except. Okay, A, Gluteus Medius. Okay, so yes. So yes, A is absolutely correct answer. Question number 11. Can you tell me what is A? Can anybody tell me what is A? Yes, many of you have definitely given the right answer. Can you tell me what is A? Superior gamelli? No, no, no. Anything else? Gluteus maximus? No, no, no. Minimus? Yes, absolutely right. Minimus is the right answer. This is gluteus minimus muscle. So let me show you. All other labelings are absolutely correct. So definitely, if you enlarge this structure, what you can see, these cut end of the fibers, which is overall. So you can just see here. Actually, this is the outer. Yes, this is gluteus. No, this is gluteus. This is the cut part of gluteus medius muscle. This is the cut part of gluteus maximus muscle. Maximus. This is the cut part of gluteus maximus muscle. And this muscle which you are seeing is this muscle which you are seeing here is the gluteus minimus muscle. Minimus muscle. Okay. Other than that, so definitely A is gluteus minimus muscle. Other than that, B is piriformis muscle, the key muscle of the gluteal region. And C here is the sacrotuberous ligament. This is sacrotuberous ligament. This is sacrotuberous ligament, and this is the sciatic nerve. This is the sciatic nerve. So yes, absolutely correct. Let's move on to the next. Before that, I would also like to show you a schematic diagram so that you can understand how the relations can be appreciated. So you can see here, gluteus medius is the muscle on the outer aspect or quadrant of the gluteal region, overlapped and covered by gluteus maximus muscle, and the deepest muscle in this area. So the deepest muscle in this category, if you will see this, Here you can appreciate also the deepest muscle in this category. The deepest muscle which is located here is the gluteus minimus muscle. So definitely here we have got gluteus minimus as the right answer, not the medius. Now, I would also like to show you few cadaveric images where you can see superior gluteal nerves, inferior gluteal nerves, the key muscle, the piriformis muscle, the sciatic nerve, and also the pudendal nerve and the posterior femoral cutaneous nerve in this cadaveric specimen. Yes, dear, minimus is absolutely right. Let's move on to the next. Question number 12. All of the following statement is correct regarding the marked structure in the image except. Yes, all of you, it's like Dr. Deepsha, Siva, Osama, Sheikh, and here my dear aspirants are also marking the answers, and I can see many of you are definitely giving the right answer. So many of the aspirants and many of my students, friends, are giving right answer that saphenous nerve is from anterior division. That is the wrong statement which is given here. That is the wrong statement. Why? Can you tell me saphenous nerve is a cutaneous nerve and it is a branch from anterior division? It is not correct. It is a branch from posterior division of femoral nerve. So please mark it. It's not a branch from anterior division, but it's a branch from posterior division of the femoral nerve. If I talk, can anybody give me the name of the nerve, which is the cutaneous branch from the anterior division of the femoral nerve? Can you name the nerve which is the cutaneous nerve branch from the anterior division of femoral nerve? What is the name of that nerve? Anyone? Posterior division, yes, it's from posterior. Can you tell me the name of the nerves from the anterior division? Cutaneous nerve from the anterior division of femoral nerve. Anyone? Let me see. Anyone is giving the answer. Lateral cutaneous nerve of thigh. No, dear. No, I got an answer. Medial cutaneous nerve. Yes, Lavanya, you're absolutely right. It's the medial and intermediate cutaneous nerve. It's the medial and intermediate cutaneous nerve. The first thing is that this is the area of femoral triangle which you are seeing. And in this femoral triangle, the base is formed by the inguinal ligament. The lateral border is formed by the sartorius muscle. The medial border is formed by adductor longus muscle. And you can appreciate it is having the contents inside. It is the femoral artery FA and the medial most structure which is highlighted by blue color. This is femoral vein, and the lateral most structure which you are seeing here is the femoral nerve. Okay, so these are the contents which is highlighted here. Other than that, I would like to show you the schematic diagram where you can appreciate femoral nerve. So please note down the root value of femoral nerve is, it is formed from the posterior division of anterior rami of L2, L3 and L4. It is formed by L2, L3 and L4. It is formed by L2, L3 and L4 dorsal division anterior rami. Okay. Now, below the inguinal ligament, it divides into anterior and posterior division, and its branches, two cutaneous branches from anterior division. Two cutaneous branches from anterior division of femoral nerve is medial cutaneous nerve, medial femoral cutaneous nerve, and intermediate femoral cutaneous nerve. It gives branches to pectineus from generally the trunk, and sartorius is the muscular branch given from anterior division. From the posterior division, it is giving muscular branches to quadricep femoris. What is quadricep femoris? It is formed by four muscle, rectus femoris, vastus lateralis, medialis and intermedius, and it is giving one cutaneous nerve, that is saphenous nerve, going till the level of great toe. So this was the wrong statement. Now let's move on to the next. Identify the arrow mark structure in the image. So an arrow is marked here over a foramen. Can you tell me which structure is this? Identify the arrow mark structure in the image. Identify the arrow mark structure in the image. I am definitely getting many of the answers. B is coming up. Okay. So yes, whether it's third ventricle, whether it is interventricular, foramen of Monro, fornix, and none of the above. Yeah, B. Okay. Okay, let me just check. Okay. Okay, interventricular foramen of Monro. Okay, so definitely B is the right answer. Definitely interventricular foramen of Monro is the right answer, which has been shown with an arrow. And it is interventricular foramen of Monro. So how you are going to identify, I will tell you. I would like to show you the same cadaveric image. Here you can see this cavity is the lateral ventricle, which is lying below corpus callosum. So yes, you can see here, this is the corpus callosum which you are seeing, and just below the corpus callosum, the cavity is the lateral ventricle. Now, and also you can see the location of third ventricle at the level, here is the location of third ventricle, that is a cavity of diencephalon, and a foramen is passed through interventricular foramen of Monro, which is forming a communication, for the third lateral ventricle and that of the third ventricle, and this communication is via interventricular foramen of Monro. Okay. Yes, Deepsha, Dr. Deepsha. Yes, B is absolutely right, Dr. Deepsha. Now, here also you can appreciate another image where you can appreciate the location of thalamus. So here you can appreciate the location of thalamus is here. That is the part of diencephalon, and here will be the location of third ventricle, which is having a communication via this foramen. What is this foramen? This foramen is forming a communication here, and this foramen is interventricular foramen of Monro, forming communication with the third and the lateral ventricle. Here you can see cerebral aqueduct is forming a communication with this ventricle, that is the fourth ventricle. So interventricular foramen of Monro is definitely the right answer. Now let's move on to the next, that is question number 40. All of the following are true statement regarding the structure of regarding the image shown. So see here, this is a cadaveric image showing you the scapular region from the posterior aspect. Identify the muscle and tell me which is the wrong option. So I'm getting, so can you tell me the name of the muscle? So firstly, tell me this arrow marked, can you tell me the name of this muscle? So firstly, just tell me the name of this muscle. Yes, so definitely you can tell me the name of this muscle and then we can have an identification. So let me just check. Yeah. Okay, so I'm getting B. Okay, so Osama is telling B and many others are telling B, but here I'm getting on my Plex platform. It's the many of you are giving right answer. Teres major is absolutely right. Yes, so on the platform of Plex, many of the students so are participated and they are telling the teres major is the muscle and the right answer is C. Definitely they are right. Yes, it's the lateral rotator of humerus. All of the following is true statement regarding the marked structure. So first thing is the identification. Yes, this is teres major muscle and it's the lateral rotator. It's not the, so it's, we know that teres major is medial rotator and the wrong statement about this is it's not the lateral rotator. So first thing is we have to identify the muscle. So how we are going to identify? See here. Here you can see this is the teres major muscle in this cadaveric image. This is the teres minor muscle. Okay, this is supraspinatus muscle. And this is infraspinatus muscle. So my dear aspirants, we know that supraspinatus, infraspinatus and teres minor muscle together called as SIT. And they are together inserted into greater GT. What is GT? Greater tubercle of the humerus. And on the anterior aspect, there will be subscapularis muscle, which is inserting into lesser tubercle. This is the long head of triceps. This is the long head of triceps. Okay, so we are definitely knowing that this is the teres major muscle. Now, if I talk about teres major muscle, this is the muscle which is getting innervation from lower subscapular nerve. So it is getting innervation from lower subscapular nerve. So that is absolutely correct. And this muscle is adductor. This muscle is adductor and medial rotator of humerus. So that is right. So all of you, those who want to revise about teres major muscle, please note down. Teres major muscle is the muscle on the posterior aspect of inferior angle of the scapula. It is inserting onto the intertubercular sulcus of the humerus. Yes, teres major is inserting into the medial lip of intertubercular sulcus. When we are talking about pectoralis major, it is inserting into the lateral lip of intertubercular sulcus. Arterial supply is the subscapular and circumflex scapular. Nerve supply is lower subscapular segmental supply from C5 and C6. If I talk about the action, it is causing adduction and internal medial rotation of the humerus bone or the scapula. So definitely we have got lateral rotation as the wrong option, which is not the action of teres major muscle. Yes, dear, all of you are right. Let's move on to the next one. All of the following structure passes from the marked structure in the image. Question number 15. All of the following structures passes from the marked structure in the image except. So definitely, let me just check. Many of you are given the answers. Yes. Okay. So which opening is this? Can you tell me? Yes, many of the students of the Plex platform has already given the right answer that it is a esophageal opening. So yes, absolutely correct. It is the esophageal opening is definitely the right answer. Now, if it is a esophageal opening, so you are knowing the structures passing through this esophageal opening. Definitely you are knowing the structures passing through the esophageal opening. And we know that superior epigastric vessel is the right answer, which is not passing through the esophageal opening of the diaphragm. So first thing is, see this image where you can, this is the specimen where you can appreciate that this is the vena cava opening. This is the vena cava opening at the level of T8. This is the esophageal opening at the level of T10. And this is the aortic opening. This is the aortic opening at the level of T12. This is the aortic opening at the level of T12. Okay, so these are the openings. You can also appreciate with another diagram which was corresponding to the same thing, where you can see the vena cava opening, caval hiatus. You can appreciate the esophageal hiatus and the aortic hiatus. Okay. Now, the next important point is to know the important structures traversing. So if I enlarge it, you can definitely appreciate the important structures traversing through it. Yes, dear, esophageal opening at the level of T10. Absolutely correct. So when we are talking about this, so you can see foramen of Morgagni in the right hand side and Larry. So the structures traversing is the internal thoracic artery branch, that is superior epigastric artery. Through the vena cava opening, we have got inferior vena cava and right phrenic nerve. And through the esophageal opening, we have got esophagus, we have got anterior posterior vagal trunk, esophageal branch of left gastric artery and the vein, minor openings for the greater lesser splanchnic nerves, the least splanchnic nerves, also the azagus and hemiazagus veins. Through the aortic hiatus, we have got the aorta, azagus, hemiazagus vein, thoracic duct, and aortic plexus. So all these, actually this schematic diagram is showing you the major and few minor openings through which important structures traversing, and definitely we can appreciate here that superior epigastric vessel is not traversing through the esophageal hiatus. So that was the right answer. Let's move on to the next, that is question number 16. All of the following are true statements regarding marked structure in the image. All of the following are true statements regarding marked structure in the image, except is the word, except. So which is the wrong statement? Which is the wrong statement? Take your time and mark the right answer. So yes, I've got many of the students has given the answer, and many of you have given A as the answer, because we have just discussed about this muscle in the previous MCQ also. So the first thing which I want everyone to know that which muscle is this, and then we can mark the right answer. Question number 16. Yes, A is definitely the right answer. And how we are going to approach this is by identifying this muscle. So yes, identification is easy. If you will see, let me just enlarge this. We can clearly appreciate that this muscle is lateral pterygoid muscle. This is the MP medial pterygoid muscle. This is the buccinator muscle. This is on the outer aspect of the mandible. So this is masseter muscle. And this fan-shaped muscle which you are seeing is the temporalis muscle. So the muscle identification has been done. Now here the MCQ which has been asked here, the MCQ which has been asked was about the lateral pterygoid muscle. So just in the similar kind of an MCQ which I have targeted was about this lateral pterygoid muscle only, and we were knowing that lateral pterygoid muscle is having two heads of origin, the superior and inferior head. And in that respect, I have told you the superior head of lateral pterygoid is originating from which aspect? Infratemporal surface of the sphenoid bone. What has been written here? Here you can see the superior head is originating from lateral pterygoid plus. This is definitely the wrong statement. Why? Because we know that superior head is originating from the infratemporal surface of greater wing of sphenoid and not from the lateral aspect of lateral pterygoid. It's the lower head, not the superior head. So this was the wrong statement. Other than that, all other point is absolutely correct. Absolutely correct. Yes. So yes, dear. Yes, you are absolutely right about the lateral pterygoid muscle. Yes, yes. 594 Kriti and absolutely correct. Yes. So you can see here again a schematic diagram. If I show you, you can definitely appreciate the upper and the lower head of lateral pterygoid muscle. So this is the upper head. This is the upper head and this is the lower head. Now, just now I told you upper head from the greater wing of sphenoid bone, greater infratemporal crest of greater wing of sphenoid bone. We have already discussed. And lower head is from lateral pterygoid plate, LPP, which aspect? Lateral aspect of lateral pterygoid plate and inserting into pterygoid fovea and fibrous capsule and articular disc of TM joint. So where it is inserting onto the FC fibrous capsule and articular disc of TM joint, originating from infratemporal surface of greater wing of sphenoid bone, the superior head, the lower head from the lateral pterygoid plate. And we already know that lateral pterygoid muscle is causing it's a primary muscle of mastication. It is also responsible for chewing the food, side to side movement, and it is also responsible for the depression and protraction of the mandible. Let's move on to the next, that is question number 70. Question number 70. Yes. So yes, all of the following statements are true regarding the mark structure in the image except. All of the following are the true statement about the mark structure in the image except. So I am getting a few of the answers. Let us see which of the following is the right or the wrong one. So yes, the first thing is that this we have to know about this arrow mark structure. What is it? And we have to know the structure. So actually, this is Tentorium Cerebellum. This is Tentorium Cerebellum. Okay, this is Tentorium Cerebellum, which is forming a dural fold and separating. It is protecting the cerebellum from the heavy-weighted occipital lobe of cerebral hemisphere. So yes, D is absolutely correct. It is an extension of dura mater that separates the cerebellum from the inferior portion of occipital lobe. It encloses sigmoid sinus is absolutely wrong statement. It is not a right statement, and we have to choose the wrong statement. So definitely C is the right answer. Its anterior border is free and it encloses transverse sinus is absolutely correct. Now see here, first thing is to appreciate this Tentorium Cerebellum, where you can see it is a tent-like structure which is separating the occipital lobe of cerebral hemisphere superior and cerebellum below. Its anterior, A for anterior is free and P for posterior is the attached border. So P for posterior, which is the attached border, and A is the anterior free border, which can be appreciated here. Yes. Yes, dear. Now, other than that, you can also see the dural venous sinus is enclosed by it. So let me just enlarge this image, and I just want you to appreciate here that this structure which you are seeing is the Tentorium Cerebellum, which I am showing you with the screen color. So what is this? This is the Tentorium Cerebellum. So this is the Tentorium Cerebellum of one side. This is the Tentorium Cerebellum of the other side. The next important point is if you will appreciate here, what you can appreciate that this is the anterior free border This is A for the anterior free border and P for the posterior. So this is the P for the posterior attached border. Here you can appreciate that it is enclosing superior petrosal sinus and also the transverse sinus. Two sinuses are enclosed by it. One is the superior petrosal sinus and the other is the transverse sinus. So what is it? This sinus is superior petrosal sinus, SPS, and this is TS. What is this? This is TS, that is the transverse sinus. So it is enclosing two sinuses, superior petrosal sinus and the transverse sinus. Now let's move on to question number 18. Identify the green color. Identify the green color extraocular muscle in this image. Identify the green color extraocular muscle in this image. IPS. What is this IPS? Oh, no, LPS. Yes. LPS, levator palpebral superioris, is absolutely correct. Yes, this muscle is levator palpebral superioris. So I would like to show you this image and help you to understand the identification. So if I enlarge this image, you can clearly identify the muscles here. So see here. Here you can identify that this green color muscle is LPS muscle most superiorly. The muscle with an oblique direction, this one is SO for superior oblique, and just above SO, this muscle is SR, superior rectus. This other muscle inferiorly, which is oblique, is IO, that is inferior oblique. And you can also appreciate the inferior rectus muscle. You can also appreciate the inferior rectus muscle, the lateral rectus and inferior rectus muscle. So these are the muscles, and clearly the green color highlighted muscle is levator palpebral superioris muscle. Okay, so also you can appreciate the same labeling of all the muscle which is highlighted in this image by different colors, and you can see the superior most muscle is LPS muscle, levator palpebral superioris muscle. Actually, levator palpebral superioris muscle is a muscle which is having both skeleton muscle fibers and smooth muscle fibers. When we are talking about the skeleton muscle fibers, it is getting innervation from third cranial nerve, and the smooth muscle fibers are getting innervation from that of the sympathetic fibers. So only in case of injury of third cranial nerve, there will be ptosis, partial ptosis, okay, drooping of upper eyelid, but it will be partial. Why? Because still the smooth muscle fibers of LPS is still working. So see here, this is the levator palpebral superioris muscle originating from the sphenoid bone lesser wing. It is originating from the lesser wing of sphenoid bone. It is inserting into the upper eyelid, and it is made of both skeleton muscle. It is made of both skeleton muscle and that of smooth muscle fibers. Here, skeleton muscle is getting innervation from third cranial nerve, oculomotor. Smooth muscle fibers are getting sympathetic innervation. So only if sympathetic innervation is affected, the leading condition which is seen in this condition is that of Horner syndrome. Okay. So you can see here levator palpebral superioris muscle inserting into superior tarsal plate of upper lid. Yes, dear. Yes, dear. Down and out eye with the ptosis in third cranial nerve. Yes, Sanjeev, you are right. Yes, you are right. Yes, you are absolutely right. Down and out, because third cranial nerve is damaged, but still the action of superior oblique and superior oblique muscle SO4, superior oblique muscle SO4 and LR6 is still active. So only down and out is the movement of the eye. Absolutely correct, dear. Now, among the following, which structure passes through the foramen marked in the image? So you can see the foramen, arrow marked foramen. You have to identify that foramen, easy one, and you have to tell me which of the following structure is traversing through this foramen. So, okay, this is foramen magnum and the structure traversing is A. Okay. Foramen magnum structure traversing is A. Vertebral artery is absolutely correct. Yes. So this is foramen magnum and the structures traversing is vertebral artery is absolutely correct. Actually, this is an important foramen of the posterior cranial fossa. So let me first enlarge this image. So when I am enlarging this image, you can see here In this image, you can see the posterior cranial fossa. Actually, there is an attachment of alar ligament, okay? And this alar ligament is dividing it into two compartments. So one structure, A is anteriorly and P is posteriorly. What do you mean by A and P? Here, A stands for anterior. A is anterior, that is osteoligamentous compartment. So it is osteoligamentous compartment. Why it is osteoligamentous compartment of foramen magnum? Because no nerves and vessels passes, only ligaments is passing through it. The posterior one is called neurovascular compartment. And why it is called as neurovascular compartment? Because nerves and vessels are traversing through it. So foramen magnum, that means foramen magnum is divided into two compartments. The anterior one through which only ligament passes is called osteoligamentous compartment, and the posterior part through only neurovascular vessels are traversing. Now, my dear aspirants, just have a look and please by heart it the important ligaments which is traversing through osteoligamentum compartment or the anterior part of foramen magnum. The structures traversing through the anterior compartment or osteoligamentous compartment of foramen magnum are following structures. So only ligaments, as I told you, only ligaments are passing through this foramen anterior part. Apical ligament of the tip of dens, upper band of cruciate ligament of the atlas, and membrana tectoria. These all points are very, very important. And 2 years back, the structures traversing through foramen magnum has been asked in your entrance exam. So 3 ligaments traversing through the anterior compartment is the apical ligament and the tip of dens, upper band of the cruciate ligament of atlas, the C1 vertebra, and the membrana tectoria. Now moving on to the posterior one. So moving on to the posterior one, that is the neurovascular compartment, and the structures passing through the neurovascular compartment are, so the structures traversing through the neurovascular compartment are lower end of medulla oblongata, covering of a meninges is also surrounding this structure. Other than that, fourth part of vertebral artery. Okay, can anybody tell me first part of vertebral artery is passing through which space? Can anybody can tell me? Okay, first part of vertebral artery. So here, which part of fourth part of vertebral artery is traversing through foramen magnum? Can you tell me first part of vertebral artery passing through which space? First part. I'm talking about the first part. Foramen transversarium. No, dear, that is second part. Can you tell me first part? First part. Neck, which triangular area? What is the name of posterior triangle? No. This just came into my mind. Let me tell you. Okay, so firstly, just revise the structures traversing through the posterior part of foramen magnum. The lower part of medulla oblongata covered by meninges, fourth part of vertebral artery, 11th cranial nerve, accessory nerve, anterior posterior spinal artery, and the tonsil of cerebellum. Tonsil of cerebellum, which is passing through it, and that is a case of tonsillar herniation, that is Carey syndrome. Yes, dear, subclavian triangle. So Dr. Prakaya, 594, A594, subclavian triangle. Okay. What is the other name of subclavian triangle? Scaleno-vertebral triangle. Absolutely correct. So yes, you are absolutely correct. Yes, dear, A594, Dr. Prakalya. Okay, you are absolutely correct. It's the subclavian triangle or the scaleno-vertebral triangle is absolutely correct. So have a note of all the important arteries and nerve traversing, and I would also like to give you an idea of the different parts of vertebral artery traversing. So you are absolutely right, dear. Good one, dear, good one. So yes, now please note down, this just came into my mind. So please have a note. So please write down. First part of vertebral artery passes through scaleno-vertebral triangle. Second part of vertebral artery through foramen transversum, through foramen transversarium of the upper cervical vertebra. Third part of vertebral artery is passing through suboccipital triangle. And fourth part of vertebral artery is passing through foramen magnum. Done. Through foramen magnum. Okay. So just that vertebral artery came here. So first part through scaleniovertebral or subclavian triangle. Second part through foramen transversum. The third part through suboccipital triangle. And the fourth part through foramen magnum. Now let's move on to the next MCQ. Let's move on to the next MCQ. Okay, so yes. Action of the muscle shown in the image. What is the action of the muscle? Whether it is causing flexion at PIP means proximal interphalangeal joint, and extension at DIP, flexion at metacarpophalangeal joint, and extension at the proximal interphalangeal joint, adduction of fingers or abduction of fingers. According to you, which is the best answer? So I'm getting okay, lumbricals and B. Okay, so which muscle is this? Absolutely right. Few of the students have identified. So I'm getting A and D and the, okay. So yes, dear, if I talk about the right answer, action of the muscles shown in the image. Okay, dear. So definitely we are getting B, lumbricals. Yes, B is absolutely right answer. B is absolutely right answer. Yes, this is the four lumbrical muscles, which is originating from the tendons of FDP. What is FDP? Yes, dear Dr. Deepsha, you are absolutely right, Dr. Deepsha. It is the lumbrical muscle originating from the tendons of FDP, flexor digitorum profundus, and it is causing flexion of metacarpophalangeal joint and extension at the proximal interphalangeal joint. Yes. So see here, this is the lumbrical muscles, first, second, third, and fourth. As you can see here, you can also appreciate the first lumbrical muscles, and the second is unipinnate. Morphologically, and the third and the fourth. When we are talking about the third and the fourth, they both are bipinnate. And the action is, what is the action? So they are causing flexion at the metacarpophalangeal joint and extension at the interphalangeal joint. So the action is, what is shown in this image also is the flexion at metacarpophalangeal joint and extension at interphalangeal joint. So extension at IP and metacarpophalangeal joint, they are causing flexion. This is the action of lumbrical. Just the opposite of it is the claw hand. So just the opposite of it is the claw hand, where there is extension at metacarpophalangeal joint and there is flexion at the interphalangeal joints. Yes, dear, absolutely right. So this is what is the action of the lumbrical muscles, causing metacarpophalangeal joint flexion and interphalangeal joint distal and proximal interphalangeal joint extension. Flexion at metacarpophalangeal joint. Now let's move on to the next, that is question number 21. Identify the arrow mark structure in the image. So you can see here, there is a question mark arrow mark structure, which is highlighted here, and you have to tell me which structure is this. Whether it is external anal sphincter, levator ani, deep transverse perineal muscle, or ischiocavernosus muscle. So many of the aspirants has given the right answer, and definitely it is ischiocavernosus muscle. Absolutely correct. It is ischiocavernosus muscle. Yes, it's an ischiocavernosus muscle. So see here, exactly this was the muscle which has been asked, and this lateral muscle is ischiocavernosus. So you can also see this yellow color area, which is PV. What is this? This is PV, that means perineal body. And definitely you can appreciate that at the level of perineal body, few muscles are interlacing. So you can see here at this level, many muscles are interlacing. These are levator ani, LA for levator ani muscle of each side. This is transverse superficial perineal muscle. This is deep superficial perineal muscle. Transverse superficial perineal muscle and transverse deep perineal muscle. And also there is the bulbospongiosus muscle. This is bulbospongiosus muscles. So actually there will be interlacing of, so you can see another diagram where you can see interlacing of levator ani muscle of both the side, superficial transverse perini muscle, also deep transverse perini muscle. So how many 10 muscles interlaces? 2 levator ani, 2 superficial transverse perini muscle, 2 deep transverse perini muscle, external anal sphincter. Also you can see one external anal sphincter. So this is one, and also there is 2 side bulbospongiosus muscle. So 2 bulbospongiosus muscle. So 2 bulbospongiosus muscle, 2 superficial and deep transverse perini muscle, and we have got levator ani muscle and external anal sphincter. Along with it also longitudinal muscle coat of rectum and anal canal. So this is another one muscle. So together we have got, at this level we have got perineal body, and at the level of perineal body we have got interlacing of together 10 muscles. Yes, 10 muscles interlacing. Okay, definitely. Yes, definitely that is correct. So let's move on to the next. That is question number 22. Identify the given histological slide. Identify the given histological slide. Whether it is serous salivary gland, mucous salivary gland, mixed salivary gland, or adipose gland, which is the right answer? Okay. So mucous salivary gland is the right answer. The correct answer is mucous salivary gland. So actually, yes, it has not taken a stain. So definitely it can't be the serous or mixed one. So major problem, or the major differentiation which is required is for the the adipose and that of the mucous salivary gland. So my dear aspirants, why it is mucus, I will tell you, because there are many nuclei towards the periphery. When we are talking about adipose, there will be a single nuclei in the periphery. So here, if you will see the slide, you can appreciate that this is the slide which is, this is having a lumen, and this is a mucus acini, which is this, and there the nucleus, this is all N for nucleus is towards the periphery, and these are all mucus acini. Okay, so here also I want you to show another diagram where I just want to enlarge this so that you can see this is how these are the nucleuses of the mucus acini, and this whole structure is mucus. So this is the lumen of the mucus acini, and this is N for nucleus. This is also mucus acini, M for mucus. This is also M for mucus. And when you will see the serous, it is S for serous. What is the serous? Serous type is having taken the state. When you see the adipose, you can see one nucleus, and this white structure which you are seeing is all fat cells or adipose. What is this? These are all fat or adipose. What is this? These are all fat or adipose. Fat cells or adipose cells will have just one nucleus towards the periphery. So definitely. Now I would also like to show you this this differentiating part between, this is the feature of differentiation between the serous acini and the mucus acini. So here you can appreciate the difference between the serous and the mucus. When you compare the acini of the serous acini, it is of smaller size as compared to mucus acini. You can see the size is also tall and pyramidal in case of serous, but it is truncated pyramidal in case of mucus. The lumen is small in serous and the lumen is large in mucus. Also, you can see the nucleus is basal and pushed towards the periphery because of the thicky secretion from the mucus acini, but it is rounded and basal in case of serous. Also, there is basophilic inclusions in case of the serous acini, but there is no inclusion in case of the mucus acini. So only it is lighter stain as compared to serous acini. Got it, dear? Absolutely. So all of you can have a look and you can have a comparison of differentiation between both serous and mucus acini. Okay, so let's move on to the next MCQ. Okay, dear. So let's move on to the next one. This was a question of 2019 AIMS entrance examination. Identify the marked layer in the given histological slide. Identify. Yes, Dr. Deep Shah. Yes, Dr. Deepsha, Osama, and everyone here, please tell me which layer is this. Question number 23, question number 23. Which layer is this? Question number 23. Whether it is outer plexiform layer, whether it is inner plexiform layer, whether it is outer plexiform layer, whether it is inner plexiform layer, according to you, which is the most correct answer? Okay, so let me just check. A. Okay, meaning of you are giving A as the right answer. Yes, it's an outer plexiform layer. Absolutely clear. While it is zoom, it shows clear more. Okay, healthy Dr. Deepsha, while it is zoom, it's so clearly more. Okay, you want me to zoom it? You want me to zoom it? See here. This is the zoomed effect. So just see here. Which layer is this? Now you can tell me the correct answer. Which layer is that? The correct answer is outer plexiform layer. The correct answer is it's an outer plexiform layer. It's an outer plexiform layer. It's an outer plexiform layer. Okay. Now see here, I would like to tell you about identification of all the layers. So you can identify these layers. So here clearly you can see here, if we go from inside to out, okay, if we go from inside to out, the same diagram with the labeling I want you to show. Okay, with the labeling. So see, this is the diagram which has been asked you. So this is showing you the layers of the retina. And you can see here the layers are like this. If you go from inside to out, it's the internal limiting membrane, nerve fiber layer, ganglionic cell layer, inner plexiform, inner nuclear, outer plexiform, outer plexinuclear layer, layers of rods and cones, and pigment layer, and then is the choroid. Okay, from outside to inside, we have got outermost layer of the eye cord, that is sclera and the cornea. Then we have got the vascular layer, that is the choroid, and inner is the retinal layer. So here we can see the 10 layers of the retina. Clearly the plexiform layer, so outer plexiform layer was shown, which was residing between the two nuclear layers. So how you can identify it also, you can see here, this is a nuclear layer and this is also N for the nuclear layer. So the plexiform layer, so it is a plexiform or synaptic layer. So it will be on outer and inner between. So it is the outer plexiform layer. This is the outer plexiform layer as we are moving from inside to outside. So this is the choroid layer, that is the middle vascular cord. So definitely it will be the outer plexiform layer. It will be the outer plexiform layer. So A is the correct answer. Now I would like to give you just the characteristic feature of each layer, and then we can move on to the next MCQ. So definitely please write down the characteristic feature of each layer. This is the layers of the retina, just one line each for each individual one. So here the first layer is, if I talk about the first layer will be inner limiting membrane. The first layer is inner limiting membrane, and this inner limiting membrane is actually basement membrane. It is a basement membrane actually, which is actually formed by the Muller cells. Muller cells, that is the supporting cells for the retinal cells, supporting cells for the nerves of the retina. So it is expanded or elaborated form of the Muller cells. Internal limiting membrane. The second layer is nerve fiber layer. Nerve fiber layer. Actually, this nerve fiber layer is formed by the axons of ganglionic cell body. Ganglionic cell bodies, axons of ganglionic cells. Axons of ganglionic cells. Okay. The third layer is from inside to outside. We have got the ganglionic cell layer. When I am talking about ganglionic cell layer, it is formed by the nuclei of ganglionic cells, cell bodies of the ganglionic cells. The fourth layer is inner plexiform layer. Whenever the word plexiform layer is used, whenever we are talking about the plexiform layer, what do you mean by this? It is a synapse. It is the synapse which is taking place. So this is the synaptic layer. Inner plexiform layer is the synapse which is taking place between the bipolar axons, bipolar cell axons, and the dendrites of ganglionic cells. This is about the inner plexiform layer. This is about the inner plexiform layer. Okay, now coming to the fifth layer. So coming to the fifth layer is inner nuclear layer. Inner nuclear layer is formed by the nuclei or the cell bodies of bipolar cells, mainly bipolar cells. Along with it, other cells like amacrine cells or horizontal cells can also contribute. This is the inner nuclear layer. The sixth layer is the outer plexiform layer, which has been asked in the MCQ. And outer plexiform layer, what do you mean by this? This is a synaptic layer. So this is the synaptic layer with where the synapse has been formed between the synapse has been formed between the dendrites, with the dendrites of bipolar cells, between the dendrites of bipolar cells and the rods and cones, and the rods and the cones projection cells, bipolar cells and the rods and cones projection cells. The seventh is outer nuclear layer, and the outer nuclear layer is formed by the cell bodies of rods and cones. Here there is the synapse between the projections of the rods and cones. Now the eighth layer is outer external limiting layer. The eighth layer is external limiting layer. External limiting membrane. This external limiting membrane, which is separating the inner segment from the photoreceptor cells. And the ninth layer is the layers of rods and cones. And the 10th layer is, the 10th layer will be the retinal pigment layer. Retinal pigment layer. So actually retinal pigment layer is separating the retina from that of the choroid layer, that is the middle vascular cord. And if you will see the epithelium is cuboidal epithelium. The epithelium of the retinal pigment layer is cuboidal epithelium, is the cuboidal epithelium. So just quickly write down all the layers of the 10 layers and what it contains. So briefly, I just want to recapitulate this. So yes, many of the students and all of you have definitely identified the right one. So you can just have a look of all the layers. So all the 10 layers we have done. Now let's move on to the next one. So done. So yes, definitely we have done with all the 10 layers of the retina. I have written the name and what it contains: inner limiting nerve fiber layer, ganglionic cell layer, inner plexi. So definitely you can see the first layer is inner limiting membrane, basement membrane of the molar cell, nerve fiber cells of ganglionic cell axons, ganglionic cell with the nuclei of ganglionic cells. Inner plexiform is the synapse between bipolar cells and ganglionic cell dendrites. Inner nuclear layer is the nuclei of the cell bodies of bipolar cell mainly. Plexiform outer layer is the synapse between the dendrites of bipolar and rods and cones cells. Outer nuclear layer is formed by the cell bodies of rods and cone, external limiting membrane, then the rods and cones layer, and the next is retinal pigment layer, which is made of cuboidal epithelium. Okay, now definitely let's move on with the next one, that is question number 24. All the best, dear. Question number 24. Okay, so yes, identify. So let me just check. Okay, I am getting C as the answer. What about others? Question number. So we have got question number 24. Question number 24. Identify the arrow marked nerve in the image. Identify the arrow marked nerve in the image. So yes, few of the aspirants has given the right answer. Let me just check. C. Okay, C is the answers which is given by the students. Dorsal scapular nerve is definitely the right answer. Yes. So here what you can see, dorsal scapular nerve is definitely the right answer. So this is the image which is provided. So quickly let's identify the each one. So this part is the root of brachial plexus. This is the trunk of brachial plexus. This is the division. And this is the cords of brachial plexus. Now let's see the important branches. So this is the branch DS. So DS has been asked, and we know that DS means dorsal scapular nerve. Root value is C5. And here, this is C5, this is C6, this is C7, this is C8, and this is T1. And here C5, C6, and C7 together is forming this nerve LTN. What do you mean by LTN? Long thoracic nerve. LTN means long thoracic nerve. Here LTN means long thoracic nerve. Now, other than that, you can identify this is UT, that is upper trunk, which is giving SS, upper subs, which is giving suprascapular, and NS means nerve to subscap. NS means nerve to subclavius. So nerve to subclavius and SS means suprascapular nerve. These are the branches from the upper trunk of brachial plexus. Now coming to, this is the anterior division of upper and that of middle trunk. These are posterior division of all the three trunks, and this is the anterior division of the lower trunk. Okay, this is MT middle trunk and this is LT lower trunk. Now coming to the important branches. So let's firstly talk about the lateral cord. So when I am talking about lateral cord, it is giving LPN, lateral pectoral nerve. It is giving musculocutaneous nerve. It is giving lateral root of median nerve, MN for median nerve. So these are the branches of lateral cord. So we are talking about the branches of which cord, dear? We are talking about the lateral cord. Now let's move on to the next one, which is the posterior cord. So posterior cord is formed by the posterior division of all the three trunks, and here posterior cord is giving following branches: AN axillary nerve, the biggest branch of the brachial plexus. This is RN radial nerve, and this is US, and this is LS, and this is LDN. So here US and LS means, if I talk about US and LS, so this is US upper subscapular, and this is LS lower subscapular. This is LS lower subscapular, and TDN means thoracodorsal nerve. Thoracodorsal nerve. So done with the posterior cord and its branches. Now talking about the medial cord. So let's talk about the medial cord. So medial cord here, this will be the medial root of median nerve. This is medial root of median nerve. This is medial root and this is lateral root. This nerve which you are seeing is ulnar nerve. These two nerves which you are seeing is the medial cutaneous nerve of arm and forearm. Medial cutaneous nerve of arm, dear, and the medial cutaneous nerve of forearm. So done, and this will be MPN, that is medial pectoral nerve. So in short, we have done with the identification of all the nerves. If I just highlight it, so you can see the identification of all the nerve. Already we have taken the theory part and we have discussed this in much more detail. So just a quick revision of identification of all the important nerves of the brachial plexus. So let's quickly move on to the next MCQ. All the best, my dear aspirants. So let's move on to the next. Question number 25th. Which of the following structure crosses the marked area? Which of the following structure crosses the marked area? Which of the following structure crosses the marked area? So I'm getting, okay, many of the aspirants are giving C as the answer. Definitely it is correct. This structure is ischial spine and it is crossed by pudendal nerve. Absolutely right, dear. So this is the pudendal nerve having the root value. It is formed by the ventral rami of S2, S3 and S4, which is traversing through the pudendal canal, which is also called as Alcock's canal, and then dividing into dorsal nerve of penis and the perineal nerve. So pudendal nerve, an important nerve for the perineal reason. Absolutely correct. All of you, dear. C is absolutely correct answer. Let's move on to the next. Okay, this was again the question asked in the AIMS entrance examination 2 years back. Yes. Okay, yes, Akshay Rajput, you're absolutely right. So let's move on to question number 26. Marked structure is a area is related to which of the following structure? Marked area. Can you see the green color arrow marked area? And you have to tell me which is the relation for the structure, whether it is related to liver, whether it is related to the second part of duodenum, the stomach, or the spleen. According to you, which is the best answer? So I'm getting, let me just check. D. Okay, I'm getting D as the answer. Spleen is perfect right answer. Okay, absolutely correct. So how we are going to identify the left or the right kidney? So we are going to identify it as the left kidney because the shape of semilunar, the shape of suprarenal or adrenal gland on left hand side is semilunar. It is triangular in case of right. Also, inferior vena cava will be near to the right kidney. Inferior vena cava is near to the right kidney as compared to the left one. Now, I would like to show you a schematic diagram where you can appreciate the relations, So yes, dear, adrenal semilunar in the left hand side. So see here, you can see the area of right and the left hand side. So yes, superiorly, if you will appreciate both the side of right and the left kidney, superiorly is related with suprarenal areas in the right and the left hand side. If you will see in the left hand side laterally, there is a wide area of relation of spleen here, anterior. This is showing the anterior relation. And in the right hand side, you can see a wide area of relation of hepatic area has been shown in the right hand side, anterior aspect of the right kidney. Lower to it, you can see on both the side, we have got colonic areas. Also in the left hand side, you can see an area of duodenum is related on the right side of the kidney towards the hilum, close to it. Other than that, you can appreciate in this diagram that there is a relation of jejunal area lower down. And also there is a relation of pancreatic area close to the hilum. Above that, you can see there is also the relation of gastric area in between the suprarenal and the splenic area above the pancreatic area in the case of left side of the kidney. So in this diagram, we can appreciate, so jejunal area is also related on the right hand side. So definitely splenic area is related on the anterior lateral aspect of left kidney. So that is the right answer here. That is the right answer here. Let's move on to the next one. Question number 27. Which of the following is not supplying the marked area of the heart? So you can see the arrow is marked on one of the chamber of the heart. You have to identify that chamber of the heart. And then you have to tell me which of the following structure is not getting the blood supply. Whether it's the right coronary artery, which of the following is not supplying the marked area of the heart. So yes, let me just check the answer. So I'm getting many of the students with D as the answer, and D is definitely the right answer. Diagonal artery is only giving blood supply to the left ventricle. It is not giving blood supply to the right ventricle. This chamber of the heart is right ventricle. Other arteries which is given as the option, right coronary artery is giving blood supply to that of the right ventricle. Anterior interventricular artery is also giving blood supply to that of LAD artery to the right ventricle, also the marginal artery. We have got marginal artery as a branch of right and the left coronary artery both, but definitely diagonal artery is only giving blood supply to the left ventricular chamber of the heart. So you can just appreciate here, and you can see here the diagonal artery. If you will see the diagonal artery, definitely you can appreciate that this diagonal artery is only giving blood supply to left ventricle. It is not contributing any kind of blood supply to right ventricle. Other than that, right coronary artery is posterior descending. Also, the marginal and anterior interventricular artery or LAD artery is giving blood supply to right ventricle. So only diagonal artery is the right answer. Let's move on to the next. That is question number 28. Marked nerve innervates which of the following muscles? So you can see an arrow has been marked on the nerve. Identify which nerve is this, and then tell me which of the following muscle is getting the blood supply. Sorry, it's getting the innervation. So we have got following options. Okay, Akshay Rajput, Santosh, and Sam, Deep, Dr. Deep, Shah, and everyone here also, please mark the right answer. Which is the muscle getting innervation from the branch of facial nerve, which has been shown here? It's the upper branch. Temporal branch of facial nerve is definitely right. Which is the right answer here? Corrugator superciliary is the right answer. Yes, dear, corrugator superciliary is the right answer. The corrugator superciliary muscle, along with the part of the orbicularis oculi muscle, is getting innervation from the temporal or the uppermost terminal branch of the facial nerve. So corrugator superciliary is definitely the right answer. This is the image which has been shown you. And here you can definitely see this is the trunk which is emerging out is the facial nerve. This is the temporal branch of facial nerve which has been shown. This is the zygomatic branch. This is the buccal branches. These are the buccal branches, upper and lower buccal. This is the marginal, for marginal mandibular, and this is the cervical branch. So you can clearly see first, second, third, fourth, and fifth. These are the 5 terminal branches of facial nerve. And it is important that we are knowing that these 5 terminal branches are giving innervation to the muscles of facial expression. It is also important that we should know which muscles are getting innervation from these 5 terminal branches. So let's see that. So we can appreciate here the temporal, zygomatic, buccal, marginal, mandibular, and cervical branches. What is important for us to know is that we should also appreciate which muscles are getting innervation from these terminal branches of facial nerve. So let's see here. So see here, the temporal branch of the facial nerve is giving innervation to upper part of orbicularis, oris, frontalis, and the corrugator superciliary, which was asked in the MCQ. So definitely it is the right answer. Zygomatic is supplying lower part of orbicularis oculi. Upper buccal is giving innervation to zygomaticus major, levator labile superioris, alachnese, and the muscles of nose. The lower buccal is giving innervation to the buccinator and orbicularis oris. Marginal mandibular is supplying the muscles rhizorius, depressor angulae oris, depressor labile inferioris, and the mental slips here, mentalis. And this is the third, this is the fourth, and the fifth one is the cervical, which is giving innervation to one of the muscle located in the superficial fascia that is called as platysma muscle, example of panniculus carnosus muscle. Done. Let's move on to the next one. So now let's move on to question number 29. All of the following statement is correct about the structure marked in the image. So you have to identify the structure. So definitely, please, what I will do, you want to see a better image. So I will just enlarge this cadaveric image. So see here, I have enlarged this cadaveric image, and here, my dear aspirants, you have to identify this muscle. So this is the question mark muscle. Please identify this question mark muscle. Firstly, identify this question mark muscle. Write down the name of this muscle. Dr. Deep Shah, Dr. Akshay Rajput, Dr. Shantos, and everyone here also who is attending my live class on the Plex can definitely write the name of the muscle, and thereafter you can approach to the options provided. So all of the following statements is correct about the structure marked in the image except. So you have to add on the word except, which is the wrong one, except, which is the wrong statement here. Now you have to tell me which is the wrong statement. Definitely I'm getting few of the answers. It's the R and supinator. No dear, it's a superficial dissection only. How can it be supinator? Pronator Teres, absolutely correct. Who is this? Gayatri, and 594 and everyone. Pronator Teres is the right answer. This is the region of cubital fossa, and this muscle is in superficial plane, and this is the pronator teres muscle. So what is the right answer, dear? Now let me tell the right answer. Can you tell me the right answer, dear? So yes, dear, let me just, okay, I just want to check for the right answer. C. Okay. Wrong. Inserts into middle 1/3 of the ulna. Absolutely correct. Who is this? C. Yeah, Akshay Rajput. No, it's the Pronator Teres muscle. So C is definitely the right answer. It is the wrong statement. It is not inserting into the ulna, but it is inserting into the radius bone. Yes, definitely. So that is the wrong option. Yes, dear. Let me explain it. So first thing is the identification. So let me just enlarge this cadaveric image. When I have enlarged this cadaveric image, you can clearly appreciate this muscle is PT. What do you mean by PT? PT means Pronator Teres muscle, forming medial boundary for the cubital fossa. Medial boundary of the cubital fossa. Okay. Now, here this muscle which has been shown here, brachioradialis, is forming lateral boundary for the cubital fossa. And other muscle is flexor carpi radialis, flexor carpi ulnaris, palmaris longus. Actually, this is a cadaveric image which is highlighting the muscles of the superficial group of the forearm flexor aspect. Okay. Also, you can see the median nerve. Also, you can appreciate in this diagram the median nerve, and you can also appreciate the brachial artery, and you can also appreciate the biceps tendon. Okay. So you can see these structures also. Now, that means we have to know the details of pronator teres muscle, and this is exactly the pronator teres muscle, which is actually forming the medial border of the cubital fossa. So this pronator teres muscle is inserting onto the radius bone. It is inserting into the radius bone, and it is having the origin from the humerus bone. So see here, if I talk about pronator teres muscle, please have a revision of the origin insertion of pronator teres muscle. Pronator teres muscle, one of the superficial muscle of the flexor group of forearm, originating from the common origin, that is common flexor origin, that is medial epicondyle of the humerus and the medial supracondylar wrist, and also from the coronoid process of the ulna, where it is inserting. It is inserting into the radius bone. It is not inserting into the ulna bone. So only we have got the incorrect option as the ulna insertion. Its nerve supply is median nerve, and it is action is pronation of forearm. The action is just the reverse of supinator muscle action. So the antagonist muscle of pronator teres is supinator muscle. Okay, dear. So this is all the details of pronator teres muscle. So definitely here we have got C as the wrong option. All other option was definitely right about the pronator teres muscle. Nerve supply by median nerve. Supinator is the antagonist muscle. Insertion onto the radius muscle lateral aspect, not onto the ulnar bone. So only C is the wrong statement. Now let's move on to the next MCQ, that is MCQ number 30th. All of the following statement are correct about the structure marked in the image except. Please write down the word except. So all of the following statement is correct about the structure marked in the image except. So you have to identify the structure. What is it? And then you have to give me the right answer. So first thing is that you have to identify which dural venous sinus is this. So which dural venous sinus is this? SSS, superior sagittal sinus. Absolutely correct. Superior sagittal sinus. Question number 30th. So you have to go for the most incorrect option. Okay, so the options are slight confusing, but you have to go with the most incorrect option. So whether it is an unpaired dural venous sinus, yes, Akshay Rajput, you are absolutely right. Yes, you are absolutely right. It is superior sagittal sinus. Absolutely correct. It continues as left transverse sinus, continues as right transverse sinus, communicate with left transverse sinus. So my dear aspirants, to be more specific, if I have to be more specific, I would like to tell that the incorrect option will be B, because it is continuing most of the time as the right transverse sinus. It communicates with the left transverse sinus, but B is definitely the wrong option. It is not continuing to become the left transverse sinus. Yes, dear. So B is the wrong option. Absolutely correct. Yes. So now let me first show you this image where you can appreciate that this is the sinus, that is superior sagittal sinus. Okay. Now what you can see here, this superior sagittal sinus is running into the attached border of the flux cerebri upper border, attached border. So superior sagittal sinus is running, as you can see in the diagram. Now, other than that, you can see the superior sagittal sinus is continuing at towards the confluences of the sinus and continuing by becoming the transverse sinus. Actually, superior sagittal sinus continue by becoming transverse sinus of right hand side. So it becomes right transverse sinus. It becomes right transverse sinus. Here also you can see the superior sagittal sinus lying in the attached border of flux cerebri. It will communicate at the level of confluences of sinus and continue by becoming transverse sinus. To be more specific, it becomes the right transverse sinus. It's continuing by becoming right transverse sinus, and it communicates with the left transverse sinus, but it continues as becoming the right transverse sinus. And many of the sinuses are meeting at the confluences of sinus, straight sinus, transverse sinuses, and the superior sagittal sinuses. All these sinuses are meeting here. That is called as confluences of sinus. So let's have more detail of these points. Firstly, I would like to tell you about superior sagittal sinus, triple S. Superior sagittal sinus begins at the level of crista galli behind the level of foramen cecum. Foramen cecum is lying in the anterior cranial fossa, passes backward towards the sagittal groove, and it will be going towards the occipital protuberance, that is the internal occipital protuberance. It will reach the level of internal occipital protuberance, and there it will deviate. It will turn its sides to the right hand side and will become continuous with the right transverse sinus, and thereafter it will communicate and continue as becoming the sigmoid sinus. The right sigmoid sinus leaves the foramen through jugular foramen, and thereafter it continues by becoming the internal jugular vein. Other important point of all the dural venous sinuses are that they end by continuing with the internal jugular vein. Now, the other important point which I want you to know is the confluences of sinus, which is also called as trochlear herophily. It's a reason where the superior sagittal sinus continues with the straight sinus, ends at the level of right and the left sinus where it begins. And occipital sinus is also draining at this level. Confluences of sinus is situated in the inner aspect at the level of internal occipital protuberance. Okay, so let's move on to the next MCQ. Identify the clinical condition. Yes, dear, let me just check. Okay, many of the answers are coming up. Identify the clinical condition in the image, whether it is a condition of mallet finger, Benedict's finger, Box's finger, or none of the above. Absolutely correct. It's a condition of Benedict's finger. Absolutely correct. It's a condition of mallet finger. Yes, definitely it is a condition of mallet finger. So why it is a mallet finger? All of you please note down. This is a case of mallet finger, which is also called as drop finger, which is also called as baseball finger. Actually, in case of mallet's finger, what you can see, there is extensor avulsion. So mallet finger is a case of extensor avulsion, distal extensor tendon ruptures. Okay, so if you want to know more about mallet finger, what is this clinical condition? In case of mallet finger, there it is an extensor avulsion case. It is a case of extensor avulsion. That means distal extensor tendon ruptures. The patient of mallet finger will have inability to extend distal interphalangeal joint. This is the clinical condition associated with this. Yes, my dear aspirants. So yes. Yes, involvement of extensor muscle. 10 minutes break. Dr. Prashant Raj is telling 10 minutes break. So don't worry, dear. Just we will finish this in another half an hour. So is it okay? I will take another 20 to 30 minutes. Is it okay? Then we can just end this session. Don't worry. I will take another 20 minutes only. 20 to 30 minutes. Is it okay? Okay, dear. Okay, Prashant and everyone. We will end the session in another 20 to 25 minutes. Don't worry. quickly we will end this. Okay. Because only theory part has already been taken it. So don't worry, I will quickly solve all the MCQs. And many of you have performed very nice in this test. That was a good achievement. Now, so yes, Boxer's fracture. When we are talking about Boxer's fracture, it's a fracture of the neck of fifth metacarpal. So why not Boxer's fracture is the right answer. Boxer's fracture is the fracture of neck of fifth metacarpal, which is referred as Boxer's fracture. Most commonly, it is seen in the punching action. So only it is called as Boxer's fracture. So only Boxer's fracture is not the right answer. When I'm talking about Benedict's hand, it is seen in the case of median nerve injury. So it is seen in a case of median nerve injury where there is an injury of the FDP and FDS tendon, both for the lateral fingers. And when the person wants to make a fist, his middle and the index finger are straightened, and this condition is called as Benedict's hand. So we have got the right answer as Mallet's finger. Question number 32. Okay. All of the following is true statement about the marked muscles shown in the green, except. So first thing is that I will show you this muscle, identify this muscle. So first thing is identify this muscle, and after the identification, what you can see, you can just go through this and you can know which is the wrong statement. Okay, identify this muscle and then tell me which is the wrong statement. Let me just check. Okay. So I'm getting a mixed bundle of identification for the muscle. Extensor carpi radialis longus, extensor carpi radialis brevis, brachioradialis FCR. A different kind of identifications is coming up. Okay, dear. So which muscle is this? Question number 32. Which muscle is this? So it is inserting. So we have to identify the wrong statement. So it is just inserting onto the radial styloid process. Which muscle is this? So who have given the right answer? It's Dr. Monisha who has given the right answer. Dr. Monisha and Subhashini. Yes, this is brachioradialis muscle. So definitely the right answer will be D. What is the nerve supply of brachioradialis muscle? Brachioradialis muscle. Why? Because it is. So why it is brachioradialis muscle? Because it is originating from lateral supracondylar ridge. It is originating from lateral supracondylar ridge, and it is inserting into the radial styloid process. It is inserting into the radial styloid process. So it is brachioradialis muscle, and the nerve supply of brachioradialis is directly radial nerve. It is not getting innervation from posterior introosseous nerve. It is, so we know that extensor compartment muscle, extensor carpi radialis longus and brachioradialis, these are the two muscles which is directly getting innervation, from radial nerve. It's not the posterior introosseous nerve which is providing the innervation. So directly it is getting innervation from the radial nerve. So that is the right answer. Brachioradialis, no, 594 musculocutaneous and radial. That is the innervation from brachialis muscle, dear. That is the innervation of brachialis muscle. When I am talking about brachioradialis, this is just the radial nerve, directly from the radial nerve. So causes elbow flexion is definitely correct. Insertion on the styloid process and originating from the supracondylar ridge is definitely correct. So posterior introosseous nerve is the deep branch of radial nerve, and it is not getting innervation from posterior introosseous nerve. Hybrid muscle, that is brachialis muscle. That is the muscle of the arm. Now, what is the feature of the green color highlighted muscle shown in this image? So what is this muscle and what is its feature? Easy one. C is definitely correct. It is which muscle? So spiral is absolutely correct, and this muscle is pectoralis major muscle. This is pectoralis major muscle, and it is having spiral and twisted fibers. So definitely it's a spiral fiber. So you can see various muscles: circular, orbicularis, oculi, oris, multipinnate, deltoid muscle, acromial fibers, bipinnate, third and fourth lumbrical muscles, also the dorsal introosseae, unipinnate, palmar introosseae, first and second lumbrical muscles. Parallel muscle is the sartorius muscle. Digastric fusiform is the biceps muscle. convergent as the pectoralis major muscle. So done with this. Now let's move on to the next MCQ, that is question number 34. All of the following is correctly labeled in this diagram except. All of the following is correctly labeled in this diagram except. So A, B, C, and D. According to you, which is the incorrect labeling, dear? So I got an answer E, and definitely all of you are right. Why? Because what is E? E is Colles fascia. E is Colles fascia. It is not obturator fascia. It's not obturator fascia. Absolutely correct, dear. So see this. This is an image with a proper labeling, and we can see here, this is the deep perineal space. Its superior layer is formed by urogenital diaphragm, superficial fascia. Inferior layer is formed by inferior fascia, which is also called as perineal membrane. It is also called as perineal membrane and superficial perineal space. When I'm talking about superficial perineal space, it is having inferior boundary by the membranous layer of the superficial fascia, that is called as Colles fascia. That was wrongly labeled in the image. It is Colles fascia and it is not the obturator fascia. So definitely right. Pinate muscle image, ma'am. Pinate muscle. See here, pinate muscle. Pinate muscle. So we have just seen the lumbrical muscles. So we have seen the lumbrical muscles in where we have seen. So if you want, so there was, let me just show you pinate muscle. You want to see the pinate muscle. I have included one diagram there. I will show you. We have taken the general anatomy session there. I have shown you. So let me just show you one of this diagram. Yeah. So see here. Can you appreciate? This is for you, my dear. Let me check. Yeah, this is Raghupati. Please see this. So Raghupati, can you see this? These are the lumbrical muscles. So here you can see this is bipinate. The shape is bipinate. Can you see? This is third and fourth lumbrical muscles. This is bipinate. And this is, these are unipinate. See here, this is unipinate. This is first and second lumbrical muscles, which are the unipinate, and these are the bipinate muscles. So Raghupati, is it okay? This is how the pinate muscle looks. Other than that, rectus femoris is also an example of bipinate. So let's move on to the next MCQ. Where were we? I think we were in the question number, yeah. So we were in the question number 35. Carotid triangle is bounded by all except. So let's finish quickly. Okay, dear. So carotid triangle is bounded by all except. Few more of the images I want to discuss. So carotid triangle is bounded by all except. So let me just check. Yes, dear. So many of you have given the right answer. Definitely right. Inferior surface of liver is not forming boundary for carotid triangle. Carotid triangle boundary is by, so carotid triangle boundary is by 3C. You can see here, this is the triangle of Corlett, which is having the boundary by 3C. The upper C is the cystic artery. Cystic artery. This is the cystic duct. And this is the common hepatic duct, 3C. Yes. Now coming to question number 36. Superior border of the arrow marked space. So what is that arrow marked space and what is the superior border of this structure? So yes, dear, we have got, absolutely right. Yes, it is epiploic foramen. Can you tell me which of the following structure is forming the superior boundary for the structure formed here? What is the superior boundary? Whether it is caudate lobe, whether it is hepatic artery, whether it is bile duct, whether it is inferior vena cava, and what is the right answer? Question number 36. So I got many answers, and epiploic foramen is right, and the correct answer is caudate lobe. See here. So here you can see epiploic foramen, that is a schematic diagram. It's anteriorly, it is having the relation of lesser omentum containing three important structures: hepatic artery, the bile duct, and the portal vein. Posteriorly, it is related with inferior vena cava. Superiorly, it is related with the caudate process of the liver, and inferiorly, it is having the relation of first part of duodenum. So definitely superior relation is with the liver caudate process. So which of the following structure is located in the arrow marked space of the mediastinum? So blue color space is which mediastinum? Firstly, tell me the name of the mediastinum and what does it contain? This blue color space is which mediastinum and what does it contains? So let me just check. So yes, dear, posterior mediastinum is absolutely correct. And what does it contains? What does it contains? What is the right answer? So yes, I'm getting many right answers. Prabhani 594, Dr. Pra. Yes, many of you are given the right answer, and definitely the right answer is descending thoracic aorta, descending thoracic aorta. So see here, we can see here, this is S for superior mediastinum lying above the level of T4 and T5, thoracic vertebra and suprasternal angle. Below we have middle mediastinum, posterior mediastinum and anterior mediastinum, AM. Now see the structures. So this is how you can divide sternal angle and T4. So this is S for superior mediastinum, M for middle mediastinum, P for posterior and A for anterior mediastinum. Now, seeing the structures residing in the posterior mediastinum, the structure residing in the posterior mediastinum are following structure: descending thoracic aorta, esophagus, thoracic duct, a gyrus vein, descending thoracic aorta, few lymphatics and nerves. Now, all of the following structures are forming the boundary of marked structure in the image except coronary sinus, tendon of Todardo, septal leaflet of tricuspid valve, superior vena cava. D, very good, very good. Superior vena cava is not forming the boundary of triangle of Koch. What is this triangular space? This triangular space is triangle of Koch, founded by it is having the boundary superiorly tendon of Todardo, it is having anteriorly tricuspid valve leaflet, and it is having postero-inferiorly the opening of coronary sinus. What does it contain? It contains AV node. Triangle of Koch boundaries, and what does it contains? It contains AV node. Superiorly, it is bounded by tendon of Todardo, a subendocardial thickening. Anteriorly, tricuspid valve leaflet, postero-inferiorly the opening of coronary sinus, it contains AV node. Absolutely correct, absolutely correct. Many of these two, Santosh, Akshay, absolutely correct. Let's move on to the next question, number 39. Which of the following structure crosses the arrow marked structure in the image? So please identify the structure. What is it? Koch triangle, Vishnu, Bala, absolutely right. Subhasini, Kritri, absolutely right. Now, question number 39. Which of the following structure crosses the arrow marked structure in the given image? What is the structure and what it crosses? So, mesentery. Yes, Gayatri. Yes, Gayatri. RRR. Mesentery root, Vishnu, yes. Tanuja, RRR, yes, dear, yes. Mesentery root, what does it crosses? What does it crosses? Absolutely right. The identification, yes, and the B is the right answer. The horizontal part of duodenum, absolutely correct. Absolutely correct. See here, this is the mesentery. And we know that mesentery is having a attached border of 15 to 20 centimeters, which is descending, which is starting from duodenojejunum junction and going towards the ileocecal junction. So see here, the root of mesentery is crossed by following structure. Root of mesentery is attached to duodenojejunal junction to that of the ileocecal junction. Now, the structure crossed by the mesentery are, the structures crossed by the mesentery are horizontal part of duodenum, abdominal aorta, inferior vena cava, the right gonadal vessel, the right ureter, and the right psoas major. All these structures are crossed by the attached border of the mesentery, that is called as root of mesentery. Okay, third extensor compartment of wrist contains which of the following? Third extensor compartment of the wrist. We know that extensor compartment total of 6 are there below the extensor reticulum. What does the third tendon passes through third extensor compartment? We have done in this discussion, and let me see who is marking the right answer. Gayatri, Saruna, RR, Asha, Kritri, Monisha, Dr. Monisha. Yeah, so absolutely correct. EPL, extensor pollicis longus. Absolutely correct. Absolutely correct, dear. Yes, my dear, is the extensor pollicis longus. Yes. So actually, through the first compartment, extensor carpi, through the first compartment, the structures passing are the tendons of abductor pollicis longus, extensor pollicis brevis. Through the second compartment, ECRL and ECRB. Through the third compartment, extensor pollicis longus. Through the fourth compartment, extensor digitorum, extensor indicis. Fifth compartment, extensor digitorum, extensor digiti minimi, and through the sixth compartment, ECU, extensor carpi unlaris. C is absolutely correct, Santosh Bhar. Yes, dear, C is the correct answer. Extensor pollicis longus passes through the third compartment. ECU, sixth compartment, abductor pollicis longus, extensor pollicis brevis first, ECRL, ECB, extensor carpi radialis longus and brevis through the second, extensor pollicis longus through the third, extensor digitorum, extensor indicis, posterior introosseous nerve, anterior introosseous artery through the fourth compartment, extensor digiti minimi through the fifth, and extensor carpi unlaris through the sixth extensor compartment. All of the following muscles are marked by the arrow marked structure, except which of the following muscle is not getting innervation from the marked arrow marked structure? What is this and what is not getting the innervation? So I'm taking a look. Many of the aspirants has given definitely the right answer. The right answer is thyrohyoid. Yes, dear, thyrohyoid is the right answer. Thyrohyoid is one of the infrahyoid muscle which is not getting innervation from the ansa cervicalis loop. And this loop is ansa cervicalis. Many of you have given definitely right answer. Yes, dear, this is ansa cervicalis loop. So you can see here, if I use this is the superior and this is the inferior root of ansa cervicalis. Okay. So this is superior and this is the inferior root of ansa cervicalis. Which loop is this? This is ansa cervicalis loop. Yeah. Now, it is running on the anterior aspect of carotid sheath. So this is common carotid artery which you are seeing. It is also shown here the vagus nerve. It is also shown here the internal jugular vein. So here you can see we have got vagus nerve, common carotid and internal jugular vein. That means these three structures are having a covering that is called as carotid sheath. So on the anterior layer of carotid sheath, we have got the we have got a nerve loop, and this loop which you are seeing is the ansa cervicalis loop, which is giving innervation to infrahyoid muscle. But one of the muscle which is not getting innervation from this loop is that of the thyroid muscle. So please have a look. So you can see the schematic diagram where you can see ansa cervicalis loop. You can see C1 fibers which is passing along with running around with the hypoglossal nerve is giving innervation to thyroid muscle. So this is the odd man out. Please have a look. Other than that, through the lower root and the upper root of ansa cervicalis loop, which is formed by C1, C2, and C3, sternohyoid, sternothyroid, and omohyoid muscles are getting innervation, except that of thyroid. Akshay Rajput, anatomical snuff box. Okay, I will come to that point. So yes, there is a question on the YouTube from Akshay Rajput. Please, ma'am, summarize the boundary of anatomical snuff box. So anterolaterally. So one of the students, please write down anatomical snuff box. So please write down anterolaterally. It is bounded by extensor pollicis, abductor pollicis. Please write down abductor pollicis longus and extensor pollicis brevis. Posteromedially, it is bounded by extensor pollicis longus. Okay, roof contains cephalic vein. Roof contains cephalic vein and superficial branch of radial nerve. Content is, what is the content? Content is radial artery and floor is containing scaphoid bone. Scaphoid bone mainly. Is it okay, dear Akshay Rajput? Akshay Rajput, anatomical snuff box is when seen extended here is the depression which is seen here. Anterolaterally, it is bounded by the two tendons, abductor pollicis longus, extensor pollicis brevis. PM means posteromedially by extensor pollicis longus. Roof is having skin superficial fascia. Superficial fascia is containing superficial branch of radial nerve, cephalic vein, and content is radial artery. Floor is basically formed from the base of first metacarpal trapezium and also the scaphoid bone. Done. And also the styloid process radius. Okay, so done with this. Now let's move on to the next. That is question number 42. Marked ligament is attached to all of the following structure except. Marked ligament is attached to all of the following except. So I'm getting answers and many of the students are telling the answers A, and A is definitely the right answer. Medial cuneiform. Yes, dear, medial cuneiform is the right answer. Mass structure is attached to all of the following except. Medial cuneiform is not forming any kind of attachment for this ligament. This is deltoid ligament or medial ankle ligament. So for this, you can have a look on this ligament. So see here, in this diagram, you can see the deltoid ligament, and you can appreciate its upper attachment is on that is medial malleolus. And from the level of medial malleolus, so from the level of medial malleolus, upper attachment is medial malleolus. It is diverging in 4 directions. See here. So let's talk about each individual part. So you can see anteriorly and posteriorly, it is attached from the medial malleolus to that of the talus bone, medial tubercle of talus, and it is forming posterior tibio-talar ligament and anterior tibio-talar ligament. Now lower to it, if you will see, it is also extending from that of the medial malleolus and it is attached to that of sustentaculum tali of the calcaneum bone. This part is called as tibiocalcaneal part. What is this part? This is called as tibiocalcaneum attached to the calcaneum bone sustentaculum tali. The other extension is that of tibio-navicular, which is extending towards the tuberosity of the navicular bone. This is called as tibio-navicular. It also merges with another ligament. This ligament is called as the plantar calcaneo-navicular or the spring ligament. The other name of this ligament is spring ligament. So by seeing this image, it is quite clear to us that the deltoid ligament or medial ankle ligament is not attached to any kind of cuneiform bone. So that is the right answer. Let's move on to the next question, number 43. Marked structure is a guide to which nerve at the level of the wrist? Marked structure is a guide to which nerve at the level of the wrist? Whether it is anterior introosseous nerve, posterior introosseous nerve, median nerve, or ulnar nerve, which is the right answer? D, C. So I'm getting mixed bundle of answers, D and C. D and C. Ulnar nerve, median nerve. Okay. According to you, Akshay Rajput, Bharti, and here, let me check the answer. C, C, C. Sunana, Kriti, Gayatri, yeah, dear. So yes, the correct answer for question number 43 is median nerve. Median nerve is definitely the right answer. Yes, dear. So actually here you can see this is palmaris longus muscle. See here. So you can appreciate that this muscle tendon is long and it is merging with palmar aponeurosis. Okay. So this muscle is merging with this structure. This is the palmar aponeurosis. So this structure is the tendon of palmaris longus muscle. So palmaris longus muscle is one of the forearm flexor muscle which is degenerating, merging with palmar aponeurosis. It is forming a guide for the median nerve. So see the median nerve block. You can see here median nerve is related. Median nerve is related to the palmaris longus tendon, as you can see in this diagram. This is the palmaris longus tendon lying very close to that of the median nerve. I would also like to show you a cadaveric image for this. So see here, if I show you this cadaveric image, what you can appreciate, this is the tendon of palmaris longus muscle, and this tendon of palmaris longus muscle, if you will see this sleek muscle, is merging with PA. What is PA? Palmar aponeurosis. This is palmar aponeurosis. So it is merging with palmar aponeurosis, and just posterior to it, the nerve which is running here, the nerve which you are seeing is the median nerve. So it is related with which nerve? It is forming a guide for the identification of MN, that is median nerve. So median nerve is the right answer. Median nerve. Let's move on to the next question, number 44. What is the nerve supply of marked muscles shown in the image? So all of you, can you appreciate the arrow marked structure? Which muscle is this? And tell me what is the nerve supply of marked muscle in the image? Which muscle is this? Firstly, write down the name of the muscle and then tell me the nerve supply. Okay. So let me just check. Supinator is definitely right answer. Yes, this muscle is supinator muscle. So yes, this muscle is supinator muscle. This muscle is definitely the supinator muscle, and it is getting innervation from deep branch of radial nerve, that is posterior introosseous nerve. So what is the nerve supply? The nerve supply is posterior introosseous nerve. Posterior introosseous nerve. Absolutely correct. So this is supinator muscle originating from the supinator crest of the ulna and area in front of it, and then winding around and getting inserted to the radius bone, upper lateral aspect, upper 1/4, and the nerve supply is posterior introosseous nerve. The action is supination of forearm. Now, all of the following is correctly labeled in this histological slide except. Yes, definitely D is the right answer. What is D? So D is the wrong labeling. So can you tell me what is D? Can you tell me which lamina is D? Which lamina is D? Which lamina? Yes, dear, absolutely correct. Can you tell me which lamina is this? Can you tell me which lamina is this? Yes, Akshay Rajput, you are right. Supinal. Can you tell me which lamina is this? Which lamina is this? Yes, you are right that it is not circumferential lamina. Can you tell me which lamina is this? It is interstitial lamina. It is interstitial lamillae. It is interstitial lamillae. It is interstitial laminae. Okay, so yeah, definitely the other labeling is absolutely correct. As you can see here, you can see here, one is the Havration canal. The 3 is interstitial lamina, concentric lamina. The space which you are seeing here is the lacuna in which the osteocytes are residing. The connection between two Havration canal is done by the Volkmann canal. So this is Volkmann's canal. Yes, dear Akshay Rajput, you're right. Yes, that is the Volkmann canal. So also you can see the identifying feature is that of lacunae with radiating canaliculi, Havration system, and various type of lamina. Also, I want you to show the enlarged view of an osteon, which is also called as Havration system, which is the characteristic feature for the compact bone transverse section. You can see the lacuna in which osteocytes resides, canaliculae for the communication of different osteocytes. Also, you can see the laminas. You can see the in-between concentric lamina is the interstitial lamina. Lacunae are there. So here you can see the two osteocytes are residing in the lacuna, and the two Havration canal is connected by Volkmann canal concentric lamina, and in between the concentric lamina and that of Havration system or osteon, what lies is the interstitial lamina. What lies is the interstitial laminae. Definitely. So also see the structure, what passes through Havration canal, the nerves and the vessels, blood vessel, nerves, lymphatics passes through the Havration canal, communicating by V for the Volkmann's canal, VC for the Volkmann canal, forming communication. When you will see the longitudinal section of the bone, you can see the Volkmann canal is horizontally running and the Havration canal is vertically running. This is the difference between the transverse section and the longitudinal section of the bone. Now let's see question number 46. All of the following are correctly labeled in the diagram except, which is the wrong labeling here? All of the following is correctly labeled in this diagram except. Question number 46, just 3 more MCQs, 3-4 MCQs. So just 4 more MCQs. Okay, dear. So we have got D. Yeah, absolutely right. D is the wrong labeling. D is mylohyoid, dear. D is which muscle? D is mylohyoid. It is not thyroid. It is mylohyoid. All other labeling is absolutely correct. So see here, these are longitudinal and transverse muscle, which is the intrinsic muscles of the tongue. We have got genioglossus muscle, the bulky muscle, and the fanning of the muscle, which you are seeing. This whole muscle, which you are seeing, is the genioglossus muscle, the major contribution of the extrinsic muscle of the tongue. Below it, we have got the geniohyoid. Below geniohyoid, we have got the mylohyoid muscle. Okay. Yes, D was the wrong label. And you can see other diagrams showing you the extrinsic muscles of the tongue, genioglossus, hyoglossus, styloglossus, and also the intrinsic muscles. Intrinsic muscles, the muscle, skeletal muscle mass, which is made, which the tongue is made of, it is containing longitudinal, transverse, and verticalis muscle. Now, injury to the marked nerve can cause which of the following? So please identify the arrow marked nerve and then tell me the right answer. Question number 47. Injury to, this was also asked in 2020 or 2019 AIMS entrance exam. So this nerve is radial nerve. Okay, what about others? RRR is telling radial nerve. What about others? Median nerve, 594. Yes, absolutely right. It's the median nerve. Yes, this is the median nerve. Yes, this is the median nerve. And the right answer is loss of sensation on nail of the index finger. So C is the right answer. Definitely C is the right answer. It's a medial most structure. It's the median nerve. And we know that lateral nail buds are getting innervation from median nerve. So C is the right answer. So see here, this is the image. And here you can see here, this is the medial most structure. And this is the biceps aponeurosis. And this is the biceps tendon. And the lateral most nerve is the radial nerve. So see here. Okay, now. So this is, let me come up with the labeling. So this is the medial most structure. This is the median nerve. This will be the brachial artery. This is the bicipital aponeurosis, and actually the hint is provided by bicipital aponeurosis, which is seen medially. This is the biceps tendon. This is the biceps tendon, and the lateral most structure is the radial nerve. So actually this side is M for medial and this side is L for lateral, and the structures will be M, B, B, R if we move from medial to lateral. So if we move from medial to lateral, the structure, absolutely right, Akshay Rajput. So yes, we will see that the structures are, so we can definitely appreciate median is definitely right. Median most structure will be the median nerve. Next to it is the brachial artery. Then we have got biceps tendon, and the lateral most structure is the radial nerve. Definitely. Also in this diagram, you can see here, if you will see nicely, what you can see, this is the brachial artery and it is dividing into two terminal branches. The one which is going medially will be the ulnar nerve and the one which is going laterally. So here, this will be the radial artery and this will be the ulnar artery, dividing at the level of neck of radius. And we know that median nerve is giving innervation to, median nerve gives innervation to the dorsal lateral 3.5 of the nail wheels and also onto the lateral part of the palm and lateral 3.5 finger on the palm. So we have got definitely for question number 47, loss of sensation on the nail of index finger. So I think this is clear from this. Let's move on to the next. Which of the following nerve passes through the marked foramen as shown in the image? Which of the following nerve passes through the marked foramen shown in the image? So which foramen is this? Which foramen is this and what is the nerve? So yes, I'm getting definitely many of the right answers are coming up. Yes, mandibular foramen and the nerve is, okay, what is the nerve there? Okay. Mandibular foramen is right. What is the nerve? The right answer will be, the right answer is inferior alveolar nerve. Yes, dear Akshay Rajput. Yes, it's inferior alveolar nerve, mandibular foramen, and the nerve passing is inferior alveolar nerve. So definitely we have got D as the right answer. Definitely. So see here, we have got in this diagram the inferior alveolar nerve, which you can clearly appreciate here. This is the inferior alveolar nerve. As you can see, it is traversing through the mandibular foramen, going towards the mandibular canal, and then it is emerging out. Then it is emerging out to the mental foramen and dividing it into terminal, that is mental branches and the incisive branches. Yes, dear, incisive branches. So definitely, yes. So definitely that is the right answer. Absolutely correct, dear. Yes, so that is definitely the correct answer, dear. Let's move on to the next one. Question number 49. Identify the muscles shown in the image. Identify the muscles shown in the image. Whether this muscle is brachioradialis, whether this muscle is extensor carpi radialis longus, flexor carpi radialis, or the extensor carpi unlaris, which is the right answer. Which muscle is this? I'm getting answers as B, B, B. Which muscle? Extensor carpi radialis longus. Okay, 49, they are telling extensor carpi radialis longus. Okay. So see the insertion point at the base of second metacarpal. Extensor carpi radialis longus is definitely comes out from, so yes, extensor carpi radialis longus is absolutely correct answer, dear. Yes, dear, it's absolutely correct. Extensor carpi radialis longus. For this, all the option I want to show you the image and it will be clear. So see here, when I'm talking about brachioradialis, it is inserting on just above the radial stelloid process. When I'm talking about extensor carpi radialis longus, it is inserting at the base of second metacarpal bone. So only this is the right answer. When I'm talking about extensor carpi unlaris, it is inserting onto the base of fifth metacarpal. Fifth metacarpal. Dorsal aspect, and flexor carpi radialis onto the base of second and third metacarpal bone. Second and third metacarpal bone base from the palmar aspect. From the palmar aspect. Now, let's see the question number 50th. And this is the last MCQ. So, identify the histological slide in the given image. Which histological slide is this? Whether it is a slide of tonsil, lymph node, thymus, or the vein. Okay, tonsil, by seeing the crypts. Okay, the hint is the crypt. Anything else? Okay, tonsil. Many of the students are giving tonsil as the right answer. So definitely the answer is tonsil. Yes, this is the tonsil because tonsillar crypt, lining epithelium and lymphatic nodule is also seen. Yes, Akshay Rajput, it is tonsil. So see here, this is a slide of tonsil because you can see the lining epithelium is stratified squamous epithelium, stratified squamous epithelium. It is stratified squamous, non-keratinized epithelium, non-keratinized stratified squamous epithelium. Also, you can see lymphatic aggregation, which is a characteristic feature of lymphatic structures. This is the tonsillar crypt. This is the tonsillar crypt. So, a slide with tonsillar crypt, stratified squamous, non-keratinized epithelium, lymphatic aggregation gives us the correct answer that this is a slide of tonsil. Thymus is not the right answer because no Hazel corpus, lymph node, subscapular sinus is not there, vein no tunica intima, externa and media is there. So definitely tonsil is the right answer. Definitely tonsil. Yes, stratified squamous epithelium, non-keratinized. So this is how the tonsil slide looks. The lining epithelium will be stratified squamous, non-keratinized, germinal center, so many lymphatic nodules, tonsillar crypts are there, and definitely this is the slide of tonsil. So yes, my dear aspirants, we have done with the 50 images, and I think this will be highly helpful to you if you are going to give the examination. And I want you to give best of luck, ma'am. These questions were pretty forward, image-based in need. Could you be subclinical Korea? So actually, this was the revision. Yes, Akshay Rajput, this was the revision of images only. This session was for images only. Yes, if I come up with a clinical question, so yes, we will have clinical MCQ scenario and MCQs. There will be the twisting of the question. So this was just a revision of important images before the examination. Thank you so much. All the best. All the best. Yes, definitely. The students of Dr. Plex will get, we kindly request you to give your feedback for rapid revision response for. Yes, I want that everyone, my dear students, I want that for your images, it is important that you should go through the images of, so I want that I have taken the sessions and you can go through the images which I have provided you in the sessions of the muscles. So I just want that, just go through all the images, cadaveric images, which we have discussed about the neuroanatomy sections, also the images of head and neck muscles, also the images which has been included for the upper limb and lower limb, also few of the histological sessions, which is very important. And I wish you all the best, that you should definitely target your dream rank in the coming examination. Clinical question scenario, few of the students of the YouTube session are telling the twisted clinical questions. So definitely we will come up with. This was a revision for the images for the Plex students. I wish them best of luck so that they can target their dream rank in the coming examination. All the best. Thank you so much. We will meet again with the upcoming session. So do revise all the images which has been given to you. And in my sessions, I have definitely included so many images. All the best. Thank you so much. Ma'am, want the PDF? Yes, I think it will be shared to the students of the Dr. Dr. Plex students will definitely get the PDF of all the images. Thank you so much. Thank you so much. All the best. Keep studying. All the best. God bless. Thank you. Thank you, dear. Thank you. Thanks, everyone. Thanks. Thank you.